All right. Well, listen, we're going to get started. I hate to infringe on anybody's time. We're supposed to start at 10 o'clock, so it is what it is, right? But thank you all for coming. This is a great audience. Oh, my God, I feel so good. All warmed up inside for this third annual Together We Win Prostate Cancer, Breast Cancer Summit Symposium 2024. My name is Dr. Eddie Wright. I'm the founder and the CEO of We Can Win. And we'll talk a little bit about that in just a little while. All right, so we were supposed to have my pastor here this morning to do the invocation. I believe that we should involve God in everything that we do. And so since he's not here and I am a consecrated bishop and the assistant pastor, how about if I just say a quick prayer and we'll just get on the move? Is that okay? All right, now look, we're not going to have church because we have church, then there's no ushers to get the offering. Okay, y'all awake, y'all awake. That's all I was trying to see if y'all awake. All right, let's go before the Father. Father, we thank you, God. We bless your holy name. We give you glory and we give you praise. We thank you, God, for this meeting today, God, this symposium that you have given me the vision to push and to continue to strive to bring good information to our communities about early detection and screening in breast and prostate cancer. God, I thank you for these doctors who have volunteered their time to come and share with us. I thank you for every sponsor, for every vendor. I thank you for every award recipient today, God. I thank you for our scholarship recipients in the name of Jesus. I thank you for those who are volunteering with We Can Win. Thank you for my wife, God, for her untiring effort to make sure that this thing is always A1. And so we're asking today, God, that you would come into this place, remove anything that's not like you, and God, that you would give us vision, new dreams, and new ideas. And I ask that the information, God, that's shared today with prostate cancer survivors and those who are in treatment, for caregivers, and for those of us who are just in the prostate cancer and breast cancer space, I ask that you would continue to bless us so that we might be able to help somebody else. We'll give you all the glory, the honor, and the praise. In Jesus' name, amen. All right, I thank y'all so much for that. Mic stand down. Okay. Thank you. We want to also thank you. By the way, since she's already up here, that's my wife, Shawana, right? She's the reason why I am what I am when it comes to this organization and other stuff. She has worked extremely hard these last 4 years to help me to make this organization a success. My total quest in this is to save but one life. If I can save or help save one life, I believe that the mission has been accomplished. You might ask yourself, why would he start an organization like this? Well, since you asked, let me tell you why. In 2012, I was diagnosed with low-grade prostate cancer. My doctor called me in. I was living in California. I was 52 years old, and he called me in, and he says, I need you to come back to see me because your PSA is off. I'm like, my what is off? My PSA, what in the world is PSA? He said, oh, that has to do with your prostate. I said, my what state? Prostate, what is prostate? Now listen, I'm a pretty educated guy, thought I was, had it all going on up here, but did not know what a prostate was. So he called me in and we had a conversation. He says the PSA is what determines whether or not you have prostate cancer at any level. I'm like, yeah, okay. So he sent me over to Palo Alto Medical Foundation in Palo Alto, California, to meet with a radiologist. The radiologist decided that I should have a biopsy, so I did that, and the most uncomfortable feeling I ever had in my life. On my journey, I had 6 biopsies. Whew. Nobody should have that many biopsies. I had 6, right? And so he says, okay, well, we'll call you back in about a week. We'll give you your results. I said, okay. So I was flying to Jamaica for vacation, so I flew to Mobile. I'm waiting on a flight to fly into Ocho Rios, and I get a call from my doctor. and he says this to me. He says, Mr. Wright, I just want to inform you that we found a small trace of prostate cancer about the size of the tip of an ink pen, but don't worry about it. Dude, are you serious? Did you just tell me I had prostate cancer and don't worry about it? Right? Okay, yeah. He says, nah, just go on vacation and come back, and when you come back, we'll all meet, so forth and so on. So fast forward a few years, met with a number of radiologists, urologists, and oncologists, and dietitians, and PCPs, and so many other kind of medical doctors and stuff, until I was so confused I didn't know whether I was going left or right. So I said, okay, well, what are my options? Am I going to die from this thing? So in 2015, I moved from California to Texas, went to VA hospital for a couple of years, and the radiologist over there says, listen, I think I'm going to send you to UT Southwestern because I see movement in your prostate. I'm like, okay. So I go to UT Southwestern, and I meet this fantastic team of medical professionals. And look, I'm not just saying that because they're in the house, but I'm saying it from the heart. Never, ever in my life have I met medical professionals like those at UT Southwestern, especially my doctor, Dr. Hanan, who just happened to have this nurse practitioner who became my sister from another mister. Tamara Dickinson. Raise your hand back there, sis. I fell in love with the two of them on day one, because when I was sat in the room, she and Dr. Hanan sat down in a chair, one on each side or right in front of me, and they at eye level, and here's what came out of Dr. Hanan's mouth. I'll never forget it. He says, Mr. Wright, this is not going to kill you. Now, I'm good after that. Give me the 2 pieces of biscuit and I can go home now, right? He says, this is not going to kill you. He says, here's what's going on. So he started talking about options. Gentlemen, you need to know that there are some options out here for us. And today, I hope you learn about some of those options that you didn't know about before today. Because the information that we have been getting in our community, the black, brown community, has either been misinformation or disinformation. And people say to me, why do you always concentrate on stuff going on in the black community? Because cancer, prostate cancer affects all men. I say, you're absolutely right. But it affects my men differently than it affects your men. And my guys are dying at, 6, 8 times the rate of any other race of a disease that's 99% curable? Come on, man, you gotta be kidding me, right? You would not believe how many conversations I have with African-American men who says, Dr. Wright, I just didn't know. We had a guy last year saw us on Fox 4 News. He called us up. There's a guy that he was seeing, the urologist, was about to remove his prostate. We sent him over to UT Southwestern. He met with a doctor over there. Come to find out, the guy did not have prostate cancer, and his prostate was totally healthy. But this guy was about to remove his prostate. Come on, guys. Listen, I'm not a racist at all. I don't deal with racism. I love people. I don't care what your skin color is. But let's deal with the fact of the matter. The fact of the matter is that prostate cancer affects our community more than it affects anybody else's community. The fact of the matter is, in our community, we're not getting the information that the other communities are getting. The fact of the matter is that health inequities have kept us from seeking quality medical care. The fact of the matter is that we're not treated the same way in 2024 as everybody else is. So when I go to UT Southwestern and walk through those doors, I feel like I'm in a place altogether different because I'm welcomed. My skin color has nothing to do with what's going on inside of my body. I have concerned doctors that care about what's going on, especially in the African-American community. Well, how do you know that, Dr. Wright? Because if you've driven through the Dallas-Fort Worth area and seen some of the media stuff that I've done with UT Southwestern, some of the billboards that had my little cute face on the had my little face on the billboards all over the Dallas and Fort Worth areas. If you've seen the video clips and the number of magazine releases that my good friend Mary Whitmore back there, raise your hand, shake your hand, Mary, who handles all the media stuff, who does not hesitate to call me and put me in check. Y'all know what I mean by that, right? She'll send me an email. She said, Dr. Wright, you know, this was not right on your flyer. I love you, Mary, because I need those eyes. She says, Dr. Wright, the name that you have for the Harold Simmons Center needs to be changed. I said, yes, ma'am. I immediately called the graphic artist and said, you need to change this because Mary Whitmore said it's not right. But my team over there is amazing. And if you're not comfortable with your urologist, find you another one. Remember, you are the customer. You pay that bill. If the doctor tells you, no, I'm not going to do a PSA, I'm going to do a DRE, or digital rectal exam. Listen, you guys are going to hear some stuff today that may not make you feel comfortable, but that's a great thing. It's a great thing to be in a place where you can't get comfortable. And today I don't want you to be comfortable. I want you to be educated. You're among prostate cancer survivors. You're among men who suffer from prostate cancer surgery, the after effects. You're among men that deal with ED after prostate cancer. You're among men that have been in depression. You're among men that have walked this walk and talked this talk so that all of you all, males, will have a better idea of what to do if you were diagnosed with prostate cancer. So in 2017, Dr. Hanan said to me, listen, let's do this. We're going to, and I know I'm going to mess this up, but whatever the clinical trial was, I can't, medical words about as long as this podium, so I'm not going to try to go there. But I had a clinical trial. See, some of y'all cringe when y'all heard me say that. Because in our community, when you say clinical trial, what's the first thing come to mind? Tuskegee, right? Guys, Tuskegee was more than 80 years ago. It's over. Get over it. Don't die over something from the past. That stuff is over, right? Ain't nobody experimenting on us. And if they are, and I find out about it, I'm the vocal guy. I talk real crazy. I'll tell you about that in just a second because we're going to move on. In 2017, when we decided to have this procedure, I had the procedure. I went in. It took about a year to get everything intact. I went in December 2018. I had to implant three seeds implanted right at the damaged area of the prostate. Very uncomfortable situation, but I had 9 people in that room, and I guarantee you they must have thought I was up for the Academy Award for the Comedy Show of the Year. I made everybody in the room laugh, especially when they stuck me the first time. I screamed louder than a woman delivering a baby. But they were comfortable with me, and I was comfortable with them. Since then, my PSA was 10.0 when I had the procedure. Today, my PSA is 0.07. When I go back in July, I'm believing God that's going to be undetectable. Listen, there is a cure for this thing. No matter what folks are telling you, there's a cure for this thing. And gentlemen, stop suffering in silence. 2 months ago, my niece, my great niece, lost her fiance, 62 years old, because he suffered in silence. And his prostate cancer metastasized into his liver, and it killed him. They put him in hospice, said he would live for about 30 days. He lived for about 2 weeks. I buried my 85-year-old brother-in-law a month ago, who died with prostate cancer, but not from prostate cancer. Did y'all get it? It's a difference from dying with and dying from. This thing will not kill me. And if you've been diagnosed with prostate cancer, it shouldn't kill you either. You just got to tell yourself every day, this is not going to kill me. Why is that? Because I'm going to do what I'm supposed to do. I'm going to go see my doctors. I'm going to eat right. Y'all know we don't. Uh-oh. Giovanni Ford from Forward Vibrations. She's going to be talking about healthy eating. Listen, this does not have to kill y'all, man. Right? Well, and I'm about to get to you sisters in just a second. I'm almost finished. We got to bring these doctors up. But look, here's a conversation that I've had with black men all across this country. But before I say that, when I first got diagnosed with this thing, I had a conversation with God about 3 years after that, 4 years after that. And I asked God this question. I said, God, why me? I'm writing a book right now called Why Me? The Journey of an African-American Man with Prostate Cancer. So I asked him, why me? Look, be careful what you ask God, because he will answer you. And here's what I heard his voice said in that silent moment. He said, if I had not afflicted your body with prostate cancer, read the word. The Bible says that it was I. In Nahum, the 6th chapter, the first verse, he said, it was I. 6th chapter, 5th verse. It was I that afflicted you. This is God talking to the prophet Nahum. It's I that afflicted you. I said, okay. So he says, if I had not afflicted you with prostate cancer, I would not have been able to heal you. The Bible says that I am the God that what? That healeth thee. He said, and if I would not had afflicted you and healed you, you would not have had the ability to touch millions of men's lives across this globe. I was all right after that. I said, God, if you got me, then I'm good. First 2 years of this thing, we struggled, man. We struggled financially, trying to put these seminars on. Tamara's been with us since the first one. We struggled. And now I'm watching this thing come to fruition. This year, we not only did not struggle with having this symposium, but we were able this year to have our inaugural Dr. Edward W. Wright Sr. Together We Win Educational Assistance Scholarship for 2 graduating seniors. Yep. At $1,000 each. We're also this year having our inaugural awards ceremony this afternoon, 2 CEO awards, a Survivor Caregiver Award, and then 2 awards we call the Pink Butterfly Awards for breast cancer survivors this year. So I know that the scripture says that when we wait on God, he'll produce. That's just my way of saying it. And he's showing us that he's producing. Our first symposium, we had 20 people in the audience. Last year, we had about 25. People are still coming because graduations and stuff, kids wait till the last minute to do everything. So they're coming. But I want you all to know that this will not stop. I need for you all next year to bring your teenage daughters and your teenage sons so they'll know what to do when they get older. Now, to my sisters that have joined us here today, let me say this first. To my brothers, my distinguished brothers of Phi Beta Sigma Fraternity Incorporated, thank y'all for coming. I appreciate y'all being here. To my constitutionally bound soror sisters from Zeta Phi Beta Sorority Incorporated, thank you all for your support this year. To the nonprofit of Upsilon Nu Zeta, chapter of Zeta Phi Beta Sorority Incorporated, Zealous of Love, thank you for your sponsorship this year. Ms. Eugenia Rogers, a pillar in our community and very well respected as a soror in the Zeta Phi Beta Sorority Incorporated. She's become our ma. That's what we call her now. So don't y'all get jealous, because we call her ma now. And here's what she said to me at my birthday party. How you calling me mine? You older than me. That's just like Miss Rogers. and we love her. She's been texting us all week. Is there anything you need me to do? Can I come and help stuff bags? Do you need some help at the registration? We say, nah, Mom, we just want you to come and just relax and enjoy yourself. So with that being said, we incorporated breast cancer this year because I was doing some research latter part of last year, and I saw how the numbers were spiking with breast cancer in the African American female community. My good friend and soror is here from Black Nurses Rock, breast cancer survivor, and Charlotte Davis. Is it Davis? Heron. She's a newlywed child. And that's her husband sitting next to her right there. But the numbers are spiking and killing African American women at young ages today. The mortality rate has gone up about 33%. That's crazy. The American Cancer Society says that nearly 250,000 women will be affected by breast cancer in the year 2024. 350,000 men will be affected by prostate cancer in 2024. Let's make a difference. I can't do this alone, but together we can win. Let me try that again. I can't do this alone, but together we can win. All right, I'm about to step down from here. My friend Jeff just walked in the door. Jeff, can you stand up for me, please, if you don't mind? Matter of fact, can you come up here? This is my new brother. I met this brother in New Orleans in baggage claim. He looks like a rock singer. Jeff works with Top Golf. Is that correct? I do. Works with Top Golf, and for some reason, God led us to a conversation. And I asked him, well, he saw my Sigma colors, and we got talking about the event. And then I said, well, what do you do? He says, well, I work for Top Golf. He said, I've worked several events for a lot of the D9s. I gave him my card, and he says, wow. He says, you know what? You don't mind me telling your story, do you? He says, I'm scheduled for a biopsy when I get back to Dallas. Bam, conversation. Let's talk about this. I gave him my card, never expecting to hear from him again after he walked out of baggage claim. He called me about, I think it was a week ago, and we started to talk. He had a biopsy, and they discovered that he had some low-grade prostate cancer. My only thing I could do at the time was, through that text message, try to encourage him. Because, look, we are in this thing together. We're in this together. And so Jeff is getting ready to go through some treatment. We're getting ready. Oh, my wife is about to kill me because I didn't even talk to her about this. I've been talking with Zero about starting a local prostate cancer support group. And so, Jeff, I want you to know, if you look around you, these are all of your new brothers and sisters. We're in this thing together, and we're going to see you through this thing. You don't have to walk alone. We're going to see you through. Okay? Thank you, sir. All right. Without further ado, let me just do this, and I'm bringing up Dr. Yang. I want to thank all of our vendors and sponsors. Methodist Charleston, who's here, Parkland Hospital, Carter Blood Care, of course, UT Southwestern and the Harold Simmons Comprehensive Cancer Center, Forward Vibrations, Foundation Mental Wellness, I'm not sure they made it yet, Acclinate, our new friends and partners, Real Recovery, Boston Scientific, Promise, Zero Prostate Cancer, NTA Life, and a special shout out to my frat brother Dwayne White at Instant Imprints for all these shirts, those blue bags, those koozies that are in the bags. We are extremely grateful for your gracious support and for your sponsorship of this event. It's not easy to get folks to give you stuff. But when folks call you and said, listen, Brother Dr. Wright, he calls me Bishop. He says, listen, Bishop, what else can we do to support your organization? You tell me, and then we got you. And he has held true to his word. All right? So when this is over, when we get the break for lunch, you guys please visit these vendors. Visit these vendors. There's a lot of information back there. That did I mention NTA? I did. Make sure you talk to NTA people about this insurance. All right? You need to hear this. I'm signing up as soon as I get some time to sit down and talk to y'all. Yeah, at 69 years old, I'm going up, I ain't going down. Amen. And so we have to be prepared. So to all of our vendors, thank you all for being here. Our sponsors, Boston Scientific, a 5-minute phone call, and they were on board. So I thank God for that. Parkland and all the rest of our sponsors and vendors. Listen, my niece is here, Tiani. She's going to be in the back. She has a lemonade that will knock your socks off. And so she has some small bottles, I think, today for sale. They're like $4. Y'all support her. I just found out that she's 16 years old. I thought she was 12. She's getting on my nerves. So y'all go back there and support her. Buy some of her lemonade. That's her thing. That's all she does. And let's help these young people to be entrepreneurs. She's been doing this for a long time. And the first time I drank it, I thought I was going to have to go into rehab. It's just that good. So here we have, I'm getting out the way. We're going to do this afternoon. These are our scholarship checks that we're going to be presenting to a young man and a young lady this afternoon. And so I want y'all to stay around. We have raffles. We have 2 television. NTA is going to raffle off a television. All you got to do is sign up, not pay anything, just sign up so they can contact you and get into raffle for their 43-inch TV. And then we have a 43-inch that we're going to raffle off. We have a cooler. We got some American Cancer Society shirts that we're gonna raffle off. We have a barbecue grill that we're gonna raffle off. Oh, and then we have these mugs, Dallas Cowboy mugs. All right. So let's bring our first presenter up, Dr. Daniel Yang. Just met this guy, and I'm already impressed. My God. He's an assistant professor in the Department of Radiation Oncology at UT Southwestern Medical Center, specializes in treating patients in this kind of cancer. Genie or Neri, yeah, that kind of cancer. I'm sorry, Dr. Yang, but yeah, my doctorate is in Christian theology. Dr. Yang earned his medical degree at Yale School of Medicine. He was also a Howard Hughes Medical Institute Research Fellow at the Dana-Farber Cancer Institute and a Leadership Innovation Fellow at Yale Center for Biomedical Innovation and Technology. Completed his residency in radiation oncology at Yale New Haven Hospital, where he served as chief resident. His research during residency, which was focused on machine learning applications to advance clinical oncology data quality, earned him an American Society of Clinical Oncology Young Investor Award. Man, how old are you? You look like you're like 25. Oh my God. He joined the UT Southwestern faculty in 2022. He's an editor for the journal JCO Clinical Cancer Informatics and Frontiers in Oncology. He's a member of the American Society of Clinical Oncology, the American Society for Radiation Oncology, and the Radiological Society of North America. Dr. Yang's clinical and research interests include that kind of cancers, machine learning applications for, I actually practiced this word and now I can't say it, right? For clinical oncology and informatic tools to improve patient care. He has published numerous peer-reviewed articles related to his area of research and contributed to the 5th edition of Textbook of Uncommon Cancer. Now, y'all tell me we don't have the best of the best in the house today. God blessed us. So without further ado, why don't you put your hands together and welcome Dr. Yang to the stage and make him feel like y'all like him.
Thank you so much, Dr. Wright, for that very, very kind introduction. I, so, so thank you all so much for having me to speak here today. I'm one of the radiation doctors, the radiation oncologists. So I work with, I work with folks like Dr. Hanan and Tamara that Dr. Wright mentioned. So I did have some slides, but while they're kind of loading that up, I just thought maybe I'll talk a little bit about, where radiation oncologists fit in the overall picture of a folk or somebody who's been diagnosed with localized prostate cancer. So for us, we're seeing patients, in the clinic, probably after they met with their primary care doctors or their urologist. When folks are coming to us, they probably have had a diagnosis already. And in the initial consultation, as a radiation oncology doctor, we're kind of going over, the diagnosis, what that means, what are the options available. And there's an array of options now. There's many, many different modalities of radiation. I see a number of different kind of folks from different backgrounds here in the audience. Has anyone been to a radiation oncologist or know about a radiation oncologist? That's okay. So for localized prostate cancer, we're talking about external beam radiation delivered from outside of you. Sometimes we may be talking about internal seeds, and I'll go over some of that in my talk. And we work together as part of an overall care team for a prostate cancer patient, often with their urologists, and in some cases, in the more advanced cases, with their medical oncologists as well. So maybe we can go into the slides. That's me.
Have a clicker. Should have a clicker on.
I have a clicker down here.
Just point it this way.
Okay. Does that button right here, this way? No problem. And I want to make this interactive, so please, if you have any questions at any point, interrupt my talk, raise your hand. I'll address them as best we can here. So that's me on the bottom. I joined the faculty here at UT Southwestern in 2022. I'm an assistant professor here. I see patients with genital urinary cancers. My colleague and the primary, the large proportion of my patients are prostate cancer patients. And these slides were given to me by my good colleague, Dr. Gran, as well. She's our assistant director of brachytherapy, and she gave the talk here last year. So if you can go to the next slide, we'll go over. So I guess I want to start by where is the prostate and where does prostate cancer develop in your body? Right, so the prostate is a gland, so only men have prostate, women do not have prostates. It's about the size in a normal individual. The normal size is about the size of a walnut, about a ping pong ball. And it does, slowly enlarge over a man's lifetime. Sometimes it can get bigger than that. It's situated right below the bladder there. You see that slide on the screen right is a side view of a man's prostate, right below the bladder and right on top of where the penis sits. And it's in a lot of sensitive areas, right? There's some nerves that run there. There's the rectum that goes behind it. And there's some vasculature that goes there as well. It's mainly used for as part of the production for seminal fluids, and you can live without a prostate, but it's very important for a man's reproduction. If you can go to the next slide. And prostate cancer, when it develops in the prostate gland. That's where it starts. Develops with aberrant or abnormal proliferation of the cells. it starts turning from normal glandular tissue to a cancerous tissue, and there's different grades of prostate cancer. But as Dr. Wright mentioned, prostate cancer affects many men in the United States. Actually, these are the official stats from the American Cancer Society. You can see prostate cancer is one of the most common cancer affecting men in the United States. About 300,000 patients in 2024, second leading cause of cancer-related death in men in the United States. And it disproportionately affects the African American community. If you go to the next slide, please. And Dr. Wright mentioned screening, right? What is screening? That is, he kindly shared his story about how he was diagnosed, and he was diagnosed from what it sounded like a screening test. And screening is when you're looking for this condition before symptoms become apparent. You're trying to detect it early. So for prostate cancer, we actually have a very good screening test. It's called the prostate specific antigen. It's a PSA. So what it is, it's a blood test. So you go to your doctor. If they think they are, often in this case, a primary care provider or perhaps a urologist, and they think if they think the screening test is appropriate for you, they'll order a simple blood test, just like how you go get your blood drawn for any of your other blood work. And it'll come back with a number, so that PSA blood work. Sometimes it's maybe accompanied by a digital rectal exam, but screening is, in the United States is primarily done through using the prostate-specific antigen test. And if it comes up abnormal, then that could be for a number of reasons, but it could potentially be an earlier indicator of prostate cancer. So that may be perhaps followed up by additional tests like an MRI scan or perhaps a biopsy in some cases. So you go to the next slide, please. And yes, it does work. Screening has been studied in, it's not a experimental procedure. Prostate cancer screening has been studied in large studies, both here in the U.S. and also internationally. And it's actually endorsed by a lot of the national practice guidelines. And when you talk to your primary care doctor about screening, there have been some controversies in the recent years. So you may be hearing about, depending on your age, your other comorbidities, your other, your overall health. They might talk about you might be in a shared decision-making category, but I kind of want to just leave it at that. There's really good evidence for screening for detecting prostate cancer earlier, and detecting it at a very curable stage. So if you go to the next slide, please. This is one of the guidelines. These are the NCCN guidelines suggesting screening starting at age 45 to 75 starting at age 45, but in the age range of 45 to 75 for patients at average risk. And it does highlight men, especially African American men from African American backgrounds, African American men, that screening could potentially begin earlier around age 40. If you go to the next slide, please. So this is from the I'm going to butcher the organization. I think it's the Zero Prostate Foundation, but they have some stats here. 33% of black men, 50 or older. I think these are stats from a few years ago, had a PSA test in 2018. Compared to 37% of white men. So there's certainly a disparities in terms of who's getting access to these tests, who are seeing their doctors and getting their prostate cancer screened. Black men, this is in the context of black men being, 1.7 times more likely to be diagnosed and almost twice as more likely to die from this disease, unfortunately. If we can go to the next slide, please. And this is stats from a few years ago, but about over 40,000 black men are expected to be diagnosed with prostate cancer in the U.S. each year, and unfortunately, over 6,000 of men are likely to die from this cancer, black men from this cancer in 2022. But if caught early, as Dr. Wright mentioned, this is a very curable disease for the vast majority of patients. Okay. If we can go to the next slide, please. And this is actually, this is something new, something new that came out actually just this year. This is from the Prostate Cancer Foundation, specifically giving out some guidelines for screening guidelines for Black men in the United States, starting between the age of 40 to 45 using a PSA test. And as you can see, they looked at the statistics as well, and on the bottom there, it's a little hard to see on that slide, but if you look at the highest reddish, orangish lines, that's the rate of Black men being diagnosed with prostate cancer at a much higher rate, you can see, compared to the other folks from other ethnic and racial backgrounds. And there's a number of reasons. There's socioeconomic disparities. There's differences in access. Some thought about differences in the tumor makeup and biology as well. You can go next, please. So this is what I do. I'm a radiation oncologist, so I deliver radiation for prostate cancer. So radiotherapy is actually a curative treatment for, it's a common question I get from my patients. It's a curative treatment for patients with localized prostate cancer. There's very good evidence, very long-term experience with using radiotherapy. That study that my colleague posted on the bottom there, they follow patients for over 15 years now, looking at patients with localized prostate cancer, predominantly in a lower grade, with whether they went to surgery or radiation or doing something called active surveillance. They actually had very similar outcomes. Radiation had just as good cure rates as surgery in this population. So these, it has a few different side effect profiles, which we'll talk about later on in my talk. But as you can see, in this, following these patients for over 15 years, only 5% of them developed spread of their disease, and some of those patients did not necessarily even die from that disease. And the rate of prostate cancer mortality of folks dying from the prostate cancer is really just a couple percentages in this study. If you can go to the next slide, please. So radiation comes in a lot of different forms. There's external beam radiation, which is probably the most common type of radiation that is being done for prostate cancer. They can be based on using photons or something called protons. It can also be done using brachytherapy, which are implants. They're seeds, radioactive seeds, whether permanent or temporary, that are put into the prostate. But a lot of times, as Dr. Wright shared in his story, this can be done just using the external beam approach. And there's a variety of techniques. You'll hear about, IMRT, SBRT, and at our center we do MRI-guided radiation as well as SBRT, which is just 5 treatments for this kind of for many men who qualify. If you can go next, please. So this is external beam radiation. This is what it might look like. Okay, that is a linear accelerator. Okay, that is a machine that delivers high energy X-rays, very focused onto the prostate, onto the patient. So there's, it's all outpatient based. There's no procedure involved. There's no anesthesia. Well, there could be a procedure, but there's no sedation. There's no anesthesia. Patients often ask, are you radioactive afterwards with external beam radiation? No, you're not. You go home. You interact with your kids, your family. It's convenient. It's in general very well tolerated for most folks. And Tamara, are you maybe giving a talk later about quality of life? That was last year. Okay. Good. But we can go next, please. So external beam radiation, this is all delivered from outside of you. And on the bottom there are just some examples of radiation plans, what that might look like. And we'll talk about that. The conventional schedule or the traditional schedule would have been 39 to 44 daily treatments, so over 7 to 8 weeks. But now we're able to do those treatments much shorter. We do hypofractionated schedules, so 4 weeks, so 20 to 28 treatments, so up to 5 to 6 weeks. But at our center, we're using about 4 weeks when we're doing the hypofractionated schedule. And then there's the stereotactic approach, which you might read about online or heard about. That's also called the ultra hypofractionated schedule. That's in just 5 treatments, delivered about a couple times a week or every other day. Go next, please. So this is the sequence of appointments for someone who might get radiation. So we'll see the patient in our office. Often they would have met with a urologist, had a prostate cancer biopsy and diagnosis. If they are, if they want to proceed with radiation and they're a good candidate for radiation, we're going to do that gel and markers procedure that that Dr. Wright mentioned. There's a number of products available out there now. I think there's a good product called Spacer from Boston Scientific. I think they're here today. There's also another product now called Bare Gel, both of which we use in our practice. So what it does is we're then placing a little bit of a space between the prostate and the rectum, and to create a little bit of to help to pull the highest doses of the radiation away from the rectum, to further improve quality of life, to kind of spare the rectum of the highest doses. So during this time, we'll often also put in, a few gold markers into the prostate itself, and that's to keep track of the prostate. And I think if you see on the right there, that's what those look like. They're kind of the size of a rice pellet, is what I tell my patients, or compared to the top of a match. Just little gold pieces that go in the prostate and stay there. Then when the patients undergo what we call a simulation scan, which is a mapping scan, and we'll plan out their radiation and often deliver that about a few weeks after, or about a week after. If you can go to the next slide, please. Oh, and this is just some pictures to show the anatomy of what that looks like. And you can see down there, those are pictures of what the simulation procedure will look like. So for a stereotactic approach or the ultra hypofractionated 5 treatments, we're putting patients into a very firm immobilization frame. And so that way the machine has a coordinate system and they're able to target within a few millimeters accuracy. And the delivery of the radiation is through what's called a linear accelerator. So you see that that machine there, that's delivering the radiation from outside of the patient. So again, there's these beams are high energy X-rays, so they're invisible. You don't see them. You don't feel anything at the time of treatment. If you go next, please. And I think these are some. If you go back, and this is to show how radiation really has evolved and became. The techniques of planning and the techniques of radiation has really continued to improve over the years. So I don't know if you've talked with folks who's had radiation. The kind of radiation today, I tell my patients, is very different from the kind of radiation 10 years ago. So you can see there's little leaflets in the radiation machines. That's up on the top left. That kind of really shapes the radiation beam. And then on the bottom there, the radiation machine comes around in an arc now. This is called arc. This is a arc IMRT, where then the beam is able to really shape very, very conformal to the prostate, and we're able to now use also MRI guidance to help further visualize the prostate. So for some patients, we're actually getting them doing an MRI at the time of radiation treatments. So we're able to really visualize where the prostate is and really keep track of that, and also keep track of visualize the urethra and so forth. If you can go to the next slide, please. And also, I'll also just mention briefly the brachytherapy. That's another type of radiation. That is radiation that does require anesthesia, and it's delivered in 1 or 2 visits, where radioactive seeds are placed into the prostate, or they're fed through the prostate kind of in a temporary fashion. If you go to next, please. And if you continue, go next, please. And you can see this is an example of a brachytherapy implant. So where the Cs are fed into the prostate target, and you can see the dose is really gives you a very rapid dose fall off, and try to avoid the urethra there, and also the nearby organs where you're really able to focus the dose on just the prostate itself. Go next, please. And that's, the brachytherapy procedure, it's, there's a sequence of events similar to what we talked about before. Again, we'll see the patient in consultation. And for the high dose rate brachytherapy, so meaning the temporary seed implants, these are done over 2 procedures at our center. And there's a procedure 1 and a procedure 2, and then the patients will then see them for follow-up. We go next, please. And then there's also proton therapy. I'll mention that briefly, where the radiation, there's a theoretical effect of something called a Bragg peak there, where the dosimetric fall off may perhaps be sharper, but I think this is very controversial, whether that really makes a clinical difference in prostate cancer treatment. We can go next, please. And I think this is actually, I wanted to show just, I might be going a little bit over my allotted time, so I think I just want to show what treatments are looking like at our prostate cancer center. So this is our MRI machine where we're doing we're treating prostate cancer patients on the MRI. If you go back, please. There's a patient right there being placed into being set up on the MRI linear accelerator, and then we have a team of both physicists and therapists who are at the machine, who then make sure the treatments are delivered accurately. And for each of those treatments, we're also doing during treatment MRI-based imaging right there on the right to monitor the prostate to ensure the accurate delivery of the radiation. We go next. Maybe I'll just end with a few of the clinical trial options, so things that are really on the cutting edge and new, that are available at UT Southwestern. So one is use the UroLift system, where we talked about doing the ultra hypofractionated prostate cancer, where it's available in 5 treatments. There's now a study where for men who have very large prostates or enlarged prostates, we're able to first do a procedure. We'll work with the urologists to first do a procedure where the urologist will really open up that channel of the prostate to allow the urine to pass. And then we'll still perform the stereotactical radiation afterwards. The idea is for men with enlarged prostates, it can still make this treatment an option. We go next, please. And this is a study about using something called a Decipher score. So this is a national study. We then were able to send off a Decipher test on the patient's prostate biopsy specimen. It's a genomic test. It comes back with the score of what risk category you are based on the genomics of the tumor. And whether that falls into a higher category or lower category, we then personalize the hormonal therapy portion of the prostate cancer patient's treatment. If you go next, please. And I think just to point out where radiation might be going, and this is another study that just opened. This is for patients who fall into a bit of a higher risk category, where then we're now adapting their radiation. So these are patients who do go on hormonal therapy, which is a type of therapy to suppress the body's production of androgens, which feeds the prostate and prostate cancer cells. So after that treatment, sometimes we often see the prostate cancer may shrink on the imaging. So you can see there those pictures, that what's in yellow there is the prostate cancer, really bright there on those images. I'm sorry, it's a little hard to see. And if you and as those areas of prostate cancer shrinks, we're adjusting the radiation plan so that the higher dose regions of the radiation is more focused on what is on those specific areas. This is still radiation delivered in 5 treatments, but after the first few initial treatments, we'll make an adjustment of the radiation plan based on the changes of what we see on the imaging. So that study that just opened, where we're now using this idea of what we call adaptive radiation, adapting to the patient's tumor, patient's anatomy change. And if you go next, please. I think that's all I had. And so thank you guys very much for having me. And this is okay. And that's our wonderful team down there. You know, we have that's Dr. Timmerman, our chair, Dr. Hanan, Dr. Desai, Dr. Gram, myself, and Dr. Wong, as well as there's Tamara and Shay, our wonderful nurse practitioners. So we have a whole team of folks who all work together to provide care for prostate cancer patients. So wonderful. Dr. Wright, questions? I'm sorry? I'm done, yeah.
Thank you so much again, Dr. Yang. Dr. Yang, appreciate you. All right. Good information, right? All right. So I need my, see, Brother Hampton, can you do me a favor? Can you grab that blue thingamajigam over there? Notepad, no holes or whatever. All right. So look, we're running a little late, but we're going to keep moving. And then we're going to break for lunch in just a little while. The caterer should be here with lunch for us. Thank you, sir. Caterer should be here for lunch in just a few minutes. So in some of these conversations, you know, I'm learning so much just by talking to some of our sponsors. We've been talking to Boston Scientific about some of the options for men who are dealing with erectile dysfunction after prostate cancer or after prostate cancer surgery. I want to assure you guys that there are some options. I told you all that some of these conversations may not be comfortable, but it is what it is. Erectile dysfunction is for real. No, y'all don't think it is, but it's real. And there are options that will allow you, when you're going through this stuff, to live a relatively normal, healthy sex life, right? Because y'all know, can I just be real with y'all? I'm going to be real anyway. So y'all know, if in the black community especially, if you take sex out of our relationships, out of our bedrooms, out of our households, it brings depression. Come on. It brings depression. It makes us feel like we're no longer the man that God created us to be. I've had conversations with men that are going through it and says, man, look, I'm not having prostate cancer surgery because if I do, I'm not going to be having sex anymore. So I'll tell you what, would you rather have sex or would you rather live? The choice is yours. But how about if I can offer you an option that'll give you both? Allow you to have sex and live. So we brought Boston Scientific into this place, into this space, and man, the options are amazing. They are amazing. And the reason why we, in our communities, fall short is because we don't know. If we know better, we do better. I met with a doctor named Dr. Daniela Whitman. She's one of the most noted sex therapists in the United States. She's from Ann Arbor, Michigan. I was on a Sigma webinar with her, and she says, I have clients, customers, whatever you want to call them, patients, that have active sex lives. They're 80 years old. The whole webinar got quiet. Years ago, Dr. Whitman, can you tell us how we do this? Yeah, can you tell us how we do this, right? And so there's options. There's options, and we're going to discuss some of those options here shortly. But men, listen, don't suffer in silence. It is what it is, man. You know, if it's not working, then let's try to figure out something to make it work again. When you're 69, I better stop that. You're 69 and married to a 45-year-old, you better figure something out. Because when it stops, you want to find something to make it start up all over again. Y'all ain't got to say nothing in this church. Amen. So look, the conversations are real. They are real because they happen. They happen to us, and they happen to other men, and it changes your life. Amen. And so I was just talking with Margaret and her colleague from Boston Scientific, and my head is spinning from that conversation. We're going to partner up and do some webinars together so we can make sure y'all stay informed about what's happening, right? How many married couples we have in here? Any married couples? All right, married couples. Yes, Lord. I want y'all to stay married for a long time. Till death do y'all part. And I don't mean from prostate cancer, right? I want to make sure that you have a healthy marriage, including behind closed doors, for a long time. Don't worry, y'all ain't having no children. See, look, the conversation's got to be real, right? Because we hide behind so much stuff. You know, we deal with this thing in the black community called the white coat fear factor. Y'all know what that is? If you don't know, let me tell you. Y'all scared to go to the doctor. Y'all scared the doctor's going to say something or do something that's going to throw you for a loop. I'm like, Doc, throw me for a loop. Just as long as you can catch me, I'm all right. See? So we got to start going. It's important that we go. Early detection and screening for breast cancer and prostate cancer should be your number one priority. Baby, I don't miss those doctor's appointments. Trust me. If I can't get in at the VA, I send Tamara a text message. Tamara, you need to get me in. It's time for my PSA. I don't miss mine. Matter of fact, she ain't going to let me miss mine. She going to remind me see, that's the kind of medical professionals you need. Someone that follows you and pays attention to what's going on. So if you're not comfortable where you are, make a change. Come on, people, make a change. Is that all right? Y'all mad at me? I don't care. I got the mic. It's my party. let me just honor my pastor and my first lady, Pastor Ryan Emmett Franklin, Pastor-elect Della Franklin, and our sweetheart, our church mother. She is going to be the first recipient of the Pink Butterfly Award. Amen. 14 years, huh, Mama? 14 years as a breast cancer survivor. And baby, she's about as feisty as a 15-year-old. She ain't no joke. And she don't mess with her about her children. She don't play about her children. And so we're going to move right along. We're going to ask Minister Hampton has to leave, but we want to have him to come out real quick and say something on behalf of the church. Listen, when we met with them last year, Pastor Phelps, shortly into the conversation, says this is something that we need to do for the long term. He said, so let's start off with a 5-year agreement. They gave us 5 years to use this venue absolutely free. Yeah. All of their technology, their kitchen, everything you see was donated as one of our sponsors. So kudos to Center of Life Church, right? I cannot get this thing right. Life Center United Methodist Church. Y'all see all this property around this church? They're about to build on it and be a very big pillar in our community. So pillar in our community. So thank you, Minister Hampton. He's also my frat brother. I'm excited about that. And his daughter is one of our scholarship recipients.
Well, as you mentioned, my name is Reverend Hampton. I am the family life minister here at Life Center United Methodist Church. And first of all, we just wanted to welcome you all into our big, beautiful sanctuary, what we like to call the living room of our living God. So we thank you all for coming out this morning. When I met Dr. Wright, I was at a fraternity meeting actually, and he told me about this, his organization and what they were doing. I said, you know what, we've got to get involved. And he was telling me about the challenges he was having of getting a venue. And I said, I think that I can help you with this. Not only am I a pastor on the roll here, but I'm also a trustee. So being a trustee, I can do a couple of things to try to make sure that we get things scheduled. So I brought it to my pastor, and when I brought it to my pastor, I said, hey, this is something that I think we really could help. We say that we like to be a pillar for the community. We believe that we're a living, a leading, a learning, and a loving church. Well, what better way to love the community than to deal with something that is affecting us all in our community, amen? So I believe that sometimes as a minister, it's hard for your audio to match your video. Sometimes it's hard for you to live the life and say the things that you actually say on the pulpit and live them in real life. So I took that as a challenge. And I said, I don't want to just be talking about it. I want to do something about it, amen? So I brought it to my pastor and I said, I don't know how, and I really don't care how, but we need to find a way to make this happen. So Dr. Wright, he brought it up in a frat meeting, and last year we weren't able to do it because we had conflicting venues. The chapter had something else going on. And so for the whole year, we've been pinging and telling our brothers that, hey, we need to come and we need to support this. So it's great to see some of my brothers in the audience this morning. Thank you for taking time out to come and fellowship with us today and to learn something about something that may not affect you directly, but it definitely could affect someone that you know. So thank you for that. For my beautiful sisters that are here as well, thank you all for coming out. We know we can't do anything without y'all support, so y'all keep us straight and keep us pointing in the right direction, so thank you for that. Now, to the rest of my Divine Nine brothers and sisters, look, there is no market cornered for blue and white on this thing, amen? So if you know somebody in the Divine Nine, this video will be available. Share this with them. As Dr. Wright mentioned, we've got a 5-year commitment, and this is a partnership. So a lot of the work behind the scenes, we're helping them with. Anything that you need us to do, you already know, just give me a call and we'll make sure that it happens. But to my Divine Nine brothers and sisters, we're calling you to the table as well. If you're part of the Divine Nine or you know somebody that's in the Divine Nine, we want to see this place packed out. It's not very big, but we got overflow. And we're growing, and if we need to go and rent another place, look, we've got connections with the city council here in here in DeSoto. So if we need to find another venue that's bigger, make that a problem that we could have, because that's a good problem to have, amen. So I'm speaking this thing to higher levels. I believe that this is fertile ground. God is doing something amazing here in this church, and we just want to be a part of what's going on. So that's why we wanted to partner with you, Dr. Wright, and make sure that this is going to be a success, not just this year, but in the years to come. So on behalf of our senior pastor, Pastor Brian Xavier Phelps, all the pastors and ministers on the roll, the membership, the congregation here, and the whole Texas Methodist Foundation, we welcome you. And if there's anything we can do to make your stay here today more enjoyable, we'll be happy to do that. And as Dr. Wright mentioned, I got to leave because my oldest daughter is graduating from high school today. And I can just say what an honor and blessing it is. For those of you that are fathers in here and you got daughters, all I can say is I didn't think we were going to make it sometimes. And so I know that prayer works. Prayer changes things. So y'all keep praying for me. Keep praying for all of us as we transition and we go through this thing called life together. And if there's anything we can do, as we mentioned, I'm about to leave, but my right-hand man back here, at the back of the sanctuary right now, both military men. I served for 25 years, retired as a lieutenant colonel. And I got my right-hand NCO back there, Brother Jim Gilbert. So if there's anything that he can do in my absence to make your stay more welcome, don't hesitate to ask. And thanks again for coming out. And God bless each and every one of you, and safe travels as you leave this place and continue to move forward. Because together, as Dr. Wright mentioned, we can win. Amen? Before I leave, I forgot. Putting our money where our mouth is. I told you that we would give you a little token to try to help out because we really truly believe in this. So this is just something to help out, not with just this year, but as we continue to move forward. I love you, brother, and if there's anything we can do to make this a success in the future, don't hesitate to let us know. Amen. God bless you.
Hallelujah. Oh, I forgot I'm not in church. Thank you very much, Reverend Hampton and the church, Life Center Church, for just being with us. The support that we have gotten has been amazing. You know, sometimes it's hard for us to connect with our busy schedules, and with my travel schedules, the Lord has allowed me to travel around the country, and we now have an international presence in just 4 years of our existence. And it's because of my faith in God and the words of my testimony and the things that I speak over not only my life, but the life of this is a ministry. It's not just a nonprofit. This is a ministry. And I'm grateful that I have pastors who pray me into a space where I need to be, because it's not always comfortable to be in this space. You know, people talk about you, you know, who do you think he is? Not, well, I don't never think I'm anybody. I already know who I am. And you're trying to figure out who you are. And so I'm always grateful. My pastor keeps telling me I have to keep an itinerary to keep up with your itinerary, because that's where God has taken us. And my First Lady, who operates very heavily in the prophetic ministry, has spoken so much wealth into my life. And I always say that money shouldn't make you, you should make money. When you're blessed to be a blessing, that's my prayer. I don't care about having a lot of stuff. I just want to be blessed to be a blessing. And so I have a heart to give back, because, listen, it's nothing but the grace of God that I stand here today. Nothing but by his grace. Because by right, I should have been taken out here a long time ago. I'm not going to get into my, yeah, I will. I don't care. Long time ago. You know, I was in the hairdressing business for about 17 years, and I worked with top-level entertainers, Frankie Beverly and Mays, The Temptations, these groups, and politicians. And I was able to sit next to Dr. Shirley Chisholm and have dinner with her and dine with her, dance with her. But none of that stuff meant anything to me, because I was in a stupor that I couldn't seem to get out of. And it's not where you are right now. It's not how you start, it's how you finish. I was 15 years into functional crack addiction, and then one Sunday afternoon, I asked the Lord on April the 19th, 1999 at 2:20 in the afternoon. Yeah, it was it was 2:20 in the afternoon. And I said, God, don't let me go to 2:21. If you're not going to deliver me now, take me out of here. And just like that, it was done. And I've never been to rehab. I've never been to counseling. I've been drug-free for 27 years. Yeah. And then this prostate cancer thing showed up. But blessed to be a blessing, guys. I tell this story all over the country because somebody needed to hear that story just now. Because prostate cancer will make you fall into things that you don't want to be into, just trying to mask it. You can't mask this. You got to make this. And what I mean by that is, you have to make this your own. And you have to deal with it. You can't hide it, because sooner or later it's going to expose itself. And if you're a male, before you're 60, or by the time you're 60, you're going to have some issue with your prostate. You know, y'all think y'all big and bad, but baby, prostate cancer ain't no joke. And although we deal in the African-American space, prostate cancer affects all men. Breast cancer affects all women. But I continue to say that we can win this thing if we work together. If you tell your husbands, your sons, your nephews, your baby and bro next door, tell somebody to go out and seek some help. My friend Bill Shaw is here from Reels to Recovery, have an awesome support group that goes on summit every year, twice or three times a year. I'm going in October already, put it on my calendar. I'm really going because they got one of the best chefs in Texas. So I'm going to eat some good food. I'm going to learn how to fly fish, and I'm going to have a conversation with brothers that have prostate cancer, black, white, Mexican, just brothers that have prostate cancer and dealing with it and talking about it. So thank you guys for what y'all do, Bill, to have that intimate conversation. I need to do this, and I'm going to move on. This is for Dr. Gang. Make sure I got the right one. We don't pay these doctors to be here, but we just want them to know that we do appreciate them being here. That's not it. Hang on, y'all. It's coming. That's not it. This must be it. Y'all enjoying this? Y'all getting something out of it? All right. Listen, we have these little donation pages sitting on every vendor table. If you would like to make a tax-deductible donation to the We Can Win Foundation, all you have to do is scan the QR code. It'll bring up our pay portal, and whatever amount of money you want to donate. We do not take a dime from We Can Win. 100% of the proceeds go to We Can Win to better what we do. So if you want to make a donation, no dollar is too small, thank you, or too large. For you millionaires, I don't know if you can use the QR code to donate $1 million, but if not, just let me know. We'll figure it out. The bank is right down the street. Dr. Yang, if I can have you to come back up and grab this bag right quick. Thank you so much for being with us. I really appreciate you, man. Thank you, sir. Yes, sir. All right, let's move on. This is about to get real interesting. We have Dr. Pranav Dadich. Am I saying that correctly? All right, if I'm not, y'all can catch me after it's over with. All right, from the Texas, he's a Texas urologist specialist from Boston Scientific. He deals with his education. He's a fellowship in andrology from the University of Washington, Seattle, Washington. His residency in urology at Froedhart Hospital, Medical College of Wisconsin in Milwaukee, which, by the way, I found out that Wisconsin has the largest number of cases of prostate cancer in the United States. The largest number. I was just in Toronto, Canada with Movember doing some reviews of proposals. And when I read this, getting in preparation to go there, I could not believe the numbers. And we're going to bring the doctor up in 1 second, but I could not believe the numbers. Can you believe that there is an untapped market, and that may not be the right word, but there's an untapped market of people who are dying from prostate cancer and nobody's paying attention to it? And I bet you if I paid you all $1 million each, you could not tell me what that market is. So since I don't have $1 million to pay you, and you might be educated and come up with an answer, I'm just going to tell you for free, all right? There is a community in the transgender female community. These are men who have had the full transition into women who are dying now from prostate cancer. Because not many people are paying attention to the fact that although they made that transition, they were born a male with a prostate, and they're not removing it at surgery because it's healthy. I don't get it. Maybe that's why I'm not a doctor, right? So that community is untapped because now these women who used to be men, who are now fully transitioned into being women, are being diagnosed with late-stage prostate cancer, and because they don't want to go and talk to the doctor because, they're afraid that somebody's going to talk down on them, these people are dying, and nobody's talking about it. So we can win. We're going to start talking about it because they need to know. They need to know. All right? Okay, I had to get that out. He's done an internship in urology at the Medical College of Wisconsin, Milwaukee, Wisconsin, medical doctorate, Baylor College of Medicine, Houston, Texas, and now he's with Boston Scientific, making a great impact. I had a quick conversation with him, and I'm telling you, this young man who has recently graduated, I believe, but he is so far beyond his years of knowledge of the medical profession in urology. This guy's going to blow your mind. So look, here's a question that I want to put in your mind. All right? We're going to ask the question when he's done. But here's a question I want to put in your mind. Can I live a normal, healthy sex life after prostate cancer surgery? Everybody got it? Can I live a normal, healthy sex life after prostate cancer surgery? Man, that's a tough question, isn't it? If we don't ask the question, we'll never get the answer. So the answer is in the house today. In the house today. All right? So why don't you put your hands together and welcome Dr. Dadich to the stage.
I'm just going to have these up here for reference.
Okay.
Appreciate the introduction. Hey, good afternoon, everyone. Thank you to Dr. Wright. Thank you to the Reverend, the church, all the sponsors here for having me to be a part of this important discussion about prostate cancer, both screening, treatment, and the subject that I'll be focusing on is life after prostate cancer. Because although, the diagnosis and treatment process can seem like the end of the road, there's actually a lot of things that we can do afterwards to help mitigate and treat some of the side effects that come with prostate cancer treatment. As you guys probably know, the two major modalities of treatment are surgery and radiation. Dr. Yang did a great job talking about radiation. I won't get into the surgical aspect of prostate cancer treatment today, but the simple answer is it's removal of the prostate. And there's really two big things that can happen after the prostate's removed. The prostate is very important as a continence mechanism within our urinary system. So, it helps prevent urinary leakage and control our bladders. And then also the nerves that produce erections run right around the prostate. So in prostate cancer surgery, they're often an unfortunate bystander of the effects of removing the prostate, as well as with radiation therapy. They can be damaged and affected. And that's where we get into the treatment of two of the major side effects of prostate cancer treatment, which is treatment of continence and treatment of erectile function. Could I have the next slide, please? Say that one more time. Oh, okay, great. Point it in that direction. Let's see if it works. No, I think we may be out of range. I'm clicking that right arrow. I'm assuming that's it. We can develop a hand signal or something, so I don't have to keep saying next slide. So this next slide is just a bad picture of me. That's it. We can continue to move forward with that. And then this is just a disclaimer about audio and video recording. If we could continue moving forward. So I think we learned a lot today about prostate cancer. I mean, it's effectively the most common cancer in men. A lot of times, men don't even know that this exists, and we talked a lot about PSA testing, which is extremely important. And to everyone here that's in that 45 to 75 age range, please advocate for yourself. A lot of primary care doctors may not be as aware of prostate cancer and screening protocols as urologists and radiation oncologists and medical oncologists. But it's extremely important. If they're not talking about it with you, please bring it up and make sure that you're your own advocate and get that screening done. After screening's done, and for those men that proceed to treatment, we know that there's close to 3 million men in the United States today that count themselves as prostate cancer survivors. And that journey can be tough and it can be unique for each man. Like I mentioned at the beginning of this presentation, we'll focus on 2 of the major side effects that can come with treatment of prostate cancer, which is leakage from the bladder, which is the continence portion, and changes in erectile function. Could move to the next slide. So restoring your continence. Continence simply refers to our own control over our urination. And it's something that we usually take for granted until it's affected. It's never something that anyone really thinks about until they're having to deal with urinary leakage, using pads, that affecting your social situations, the psychological burden that can create, diminishing your ability to go out into the public, into the world, and hang out with your friends because you're worried about urinary leakage. Next slide. So, like I mentioned, after prostate cancer, and as the diagram up here and Dr. Yang's presentation also noted, that's a gland that's intimately associated with the bladder as well as the external urinary sphincter. The external urinary sphincter we have control over, but the prostate also significantly contributes to our continence. After the prostate's removed from surgery, virtually all men will have some degree of leakage. For some folks, that leakage will resolve with conservative measures, and we give it about a year to see what kind of progress is made. And the majority will regain bladder control. But there are those men that really never do regain it, and that's where we come in as urologists in terms of helping solve this problem. We've gotten really dialed in and good at prostate cancer surgery. The amount of men that are suffering from leakage, that it's persistent, has greatly reduced, but it's still a big problem. Even as sophisticated as our surgical treatments get and how you become more precise, this persists and continues to be an issue. And that's where urologists who are trained in certain continence procedures and have experience with this can really help those men restore their function. Next slide, please. So in terms of, men that have leakage, even at a year, about 1 in 10 men will still have some persistent leakage, and that creates a real burden on their lives. Going through pads, like I said, minimizing the amount of social activity they have, maybe refraining from sports that they like to participate in or other active endeavors because they're worried about the leakage that's going to happen. But there are options available. Next slide, please. For mild bladder leakage, it's more about maybe controlling or compensating for the symptoms that you're experiencing. You may be using pads, adult diapers. Some special types of collection condoms can help at least not get the urine, allow the urine to get on your clothes and things like that. There's a penile clamp that, believe it or not, is a lot of men feel like is a good solution. But it's only temporary. You can only wear that for some amount of time. So you may be able to wear it for a couple hours, but you're going to have to take it off. And then there's pelvic floor physical therapy. And that's specific exercises that strengthen the muscles of the pelvis and the pelvic floor musculature that holds up the bladder. And this can really help. And, as a surgeon who does procedures and surgeries to restore continence, I always advocate for my patients to undergo pelvic floor physical therapy, either doing it on their own or meeting with the actual physical therapist that focuses on this, because it can cause a lot of improvement, but it may not fully solve the problem. Next slide, please. In terms of treatment options for milder incontinence, and this is for the guy, and I won't get into the technical aspects of how we qualify it during the clinic visits, but the guy that's not using that many pads, maybe 1 to 2 a day, and they have relatively mild incontinence. It's bothersome, it's burdening their lives, it's not totally ruining their lives. There's some very interesting treatments out there. There's some bulking agents that can be injected to actually create more resistance in the channel that urine leaks out of. And then there's also something called a male sling. A male sling is a piece of mesh that's actually put in to support the urethra and tension it. Unfortunately, that image is not showing up well here, and I wish you could see the mesh, but it effectively is able to reposition the urethra in a way that creates more resistance and prevents leakage. That's about a 2-hour outpatient surgery, and the results are pretty immediate. I did one just a month ago, and I saw the gentleman back, and he's told me that he's 100% better, and that's exactly what we want to hear. You know, that what we're doing is working. Because as urologists, we're great at taking out the prostate, but we also have created these problems, and it's our job to solve these problems as well. Next slide, please. For gentlemen that have more significant leakage, you know, moderate leakage, they're going through multiple pads a day. If we could go to the next slide on here. There are more sophisticated devices, and this is something called an artificial urinary sphincter. It was actually created by urologists to help this exact population of men. Like I said earlier, we created these problems, and thankfully urologists have been pretty active in terms of trying to solve them as well. And an artificial urinary sphincter is actually a 3-piece device that really gives you control back. I think that's the big takeaway. Using an artificial sphincter, we're able to create a seal around the urethra so that when you're walking around, participating in your daily activities, there's an actual seal there that's preventing urine from leaking out. And when you do want to go to the bathroom, there's a pump, and this is all internal. None of it's hanging outside of your body. No one can see it. No one can tell you have one. Of course, you can tell you have one because your leakage is pretty much gone. But you use that pump to deflate the sphincter. That opens the channel back up, and you're able to urinate. On its own, that sphincter will close back up to its normal state. And this is kind of considered the gold standard treatment option for men with incontinence after prostate cancer surgeries and for other reasons. It really has excellent outcomes, and it's a life-changing thing. It really gives people control of their continence back, and that gives them control of their lives back. Next slide, please. Thankfully, our partners at Boston Scientific have been instrumental in developing these devices. And they also have a lot of great information. There's a table back there where you can pick up some pamphlets. They'll link you to this website, fixincontinence.com. So again, it's not something that anyone has to suffer in silence about. There are solutions for this issue. It can be a little challenging to bring up and talk about, but as a urologist, specifically a urologist who is focused on a lot of prostate cancer survivorship and interventions for that, these are conversations that I have with folks every day. And it's really nice to take that conversation outside of the patient room and do it in more of a community format. So this is a great forum for this kind of discussion as well. Next slide, please. So as Dr. Wright was mentioning, sexual health. A little bit of a subject that many men don't like to talk about, especially after they've been treated for prostate cancer. In fact, some men know that this treatment for prostate cancer can greatly affect their erections and will forego treatment because of that, because they're afraid of what can happen. They're afraid of losing a critical part of what they feel like makes them a man, and then also losing that kind of connection with their partner and the intimacy that sexual health brings to a couple. But there are a great amount of solutions for that as well, and I'll briefly touch on them today as well. Next slide, please. So like I mentioned earlier, the nerves that produce erections run right around the prostate. And although we've gotten really good at dissecting those off very carefully and trying to do the best we can at preserving them and doing nerve-sparing surgeries, sometimes that's not possible. Sometimes we have to focus on the cancer control, and if it's getting into the area of those nerves, well, those nerves are going to be compromised when the prostate's removed. With radiation therapy, those nerves are also going to be damaged. And it can take years to regain sexual function. Nerves heal slowly, and if they have taken some damage and can recover, it's going to take some time for that healing to happen, maybe up to 2 years. For many men, I always tell folks before prostate cancer surgery, things are not going to get better after this surgery. You know, that's one thing you can expect when they ask me about what changes to erectile function are going to happen. And it's really about the magnitude of change. Some men are able to get by with conservative therapies, and some men may need further intervention. But really the resounding message that I like to tell my patients is that regardless of where you're at after the procedure or radiation therapy, there will be a solution. It just depends on how much you want to do to get there. Next slide, please. So what are the treatment options? And this slide kind of talks about the spectrum of treatment options available. There's oral medications, something that you can take either prior to sexual activity or even daily dosing. And for those men that need just a little bit of a boost, this works great. And it'll work for some time. There's vacuum pumps, which work by pulling blood into the penis. It is something that you have to manually do every time that you want to have sexual activity. Most men will say that it works, but they don't necessarily want to perform that maneuver every time they want to engage in intimacy with their partner. There's penile injections. Those are medications that are directly injected into the penis, and I know the idea of that, it can be very off-putting to some people, but they work well. Most men that I see, you know, let's say oral therapy isn't working, our guidelines recommend that the next routes that we can really go are to penile injections or to surgical options, which we'll talk about too. Urethral suppositories, that's just another medication delivery mechanism of a small pellet that's delivered directly into the urethra and dissolves and can help produce an erection. And then there's kind of the most definitive treatment, what is considered a gold standard solution, which is a penile implant. And we'll talk a bit about a penile implant because I know for the vast majority of people, just people that are not involved in the field of urology, they don't even really know this thing exists. But it's been around for 30, maybe 40 years, and it's become more and more refined over time, and it's really been a game changer in restoring sexual function, restoring manhood, restoring intimacy, restoring all of those things that men find missing when they're no longer able to have erections, and giving that back to them. If we could go to the next slide, please. So what is a penile implant? It's a 3-piece device that's all internal. It gives you total control, freedom, and spontaneity over your erections. It's something that feels natural. It's a surgical procedure to implant it. It's about 2 hours. It's an outpatient surgery. And within 4 to 6 weeks after surgery, you can begin using it. So effectively, there's 3 pieces. There's a pump, there's a fluid tank, and there's the actual cylinders that sit inside the penis. Those are sized to your natural anatomy. So no man will get something that they didn't want in terms of size. When they want to have an erection and engage in sexual activity, pumping the device transfers the fluid from the fluid tank into the cylinders. It produces a hard erection every time. It can stay up as long as you want it to, which is a bonus. And once you're done using it, you can simply deflate the device with another button on the pump, and it goes back to normal. Again, this is all internal. No one can tell looking at you in the locker room, wherever, that you have this device. And it's something that's just going to work every time and lasts at a minimum a decade. So this is really a great treatment option that has been able to restore that sexual function for men. And a surgery that I do and a few other people in the Dallas area do. And when we look at the research and the outcomes and the satisfaction rates, it's all extremely high. Next slide, please. So as far as tracking your progress, we can go on to the next slide. There are, again, various pieces of information out there. If you stop by the Boston Scientific desk here today, you'll be able to pick up pamphlets. You'll get a link to their website. I actually give out these pamphlets to pretty much any patient that I have a discussion with about erectile function in my clinic, which is a lot. That's something I specialize in. And there's a lot of good information. This is a subject matter that has been studied extensively because we know prostate cancer is extremely prevalent. There are a lot of men getting treated. We're missing men that should get treatment, and we know we're going to create side effects that we have to have solutions to make sure that we actually do right by our patients. Next slide, please. So frequently asked questions, how long does it take to achieve bladder control? I usually tell my patients that we should give it up to a year. Try pelvic floor physical therapy, try conservative measures. If at that point in time you're still unsatisfied, there's absolutely a solution that's going to help solve this problem. The next question that's on here, why don't all men recover erectile function after treatment? It really depends on the nature of cancer, the nature of the treatment, where you started out before. That's probably the biggest factor. And what other possible conditions you might have that can affect erectile function, diabetes, hypertension, those being kind of the biggest ones. And the third question on here, are penile implants covered by insurance? The answer is yes, and especially for patients who are prostate cancer survivors. Medicare does a really good job about this, and commercial insurance also does a really good job about this, because we know it's such a prevalent issue after prostate cancer treatment, and we know that the burdens of suffering from some of these side effects can really have an impact on patients' lives, and insurances have gotten much, much, much better about covering these procedures. And as a physician, if there's issues with coverage, I always write a letter of advocacy to the insurance company as well, stating, the benefits of these kind of interventions and the impact it can have on a man's life. Next slide, please. So real people, real results. There are thousands, hundreds of thousands of these people out there, and if you are a prostate cancer survivor, you're suffering from some of these conditions or side effects, and you want to talk to someone about their experience with any of these kind of interventions. There's tens of thousands, hundreds of thousands of people who have undergone these kind of procedures and interventions, and many times they'll be happy to talk to you and tell you about their experience with it. These are just two stories. You can read what they say, but I won't focus on them too much. There are thousands and maybe hundreds of thousands of men with great stories. Just some resources on this next slide. If you stop by the table after this presentation or whenever, you'll be able to get your hands on a lot of these too. FixIncontinence.com, edcure.com, the American Cancer Society, a lot of good information on prostate cancer. ZeroCancer.org, which I'm sure most of y'all are familiar with, and the National Cancer Society, which Dr. Yang had mentioned, also has great information for patients on prostate cancer. So, as far as next steps, if this is something you're suffering from, don't suffer in silence. Talk to your urologist, your doctor. It's easy to find specialists who focus on this kind of intervention. Companies like Boston Scientific have done a great job on their websites of creating finders for these kinds of things. You don't have to suffer in silence. This is a common issue that all urologists deal with to some degree, and folks that are more subspecialized like me deal with all the time. So there's going to be someone to help you. Lastly, just another bad picture of me, and if anyone has any questions, I'd be happy to answer them, and otherwise, I'm sure everyone's excited to get to lunch. Awesome. Thank you, guys.
Okay, so as y'all see, I'm running around here wearing like a million hats, right? Make sure everybody's good? Yeah. Everybody's good. Thank y'all again for being here. I neglected to mention one of our sponsors, and I apologize for that. Tillex, where are you? Where's Tillex? All right. My friend from Tillex, Amber, and her crew, I really appreciate y'all being here. I know Amber and I had, I don't know how many emails going back and forth, but she made it happen for us. And they were one of our biggest sponsors for this year's event. So I want to shout out to all of our sponsors again. We are rearranging things in the vendor lounge so that we can maximize space so that everybody can have a place to sit for lunch. When to have not enough room with too many people is a good thing. That's a good thing. So I'm excited about y'all because y'all came out. Dr. Dadich, I believe this is yours. Where's Dr. Dadich? Let me just make sure. Let me just make sure. Because my wife will be mad at me. She'll normally put a name on these things, but I think she's, that's all right, just throw away the box. Well, we got a lot. Yeah, this is yours. All right, thank you very much. Yes, sir. You can remember us by just looking at the box. Yes, ma'am. All right, so we're going to bring our next morning speaker up. After her, we're going to break and go to lunch, and then we'll come back with the rest of our speakers. Again, I do apologize to all of our speakers that we were running a little bit behind time this morning. We had some technology problems, but we're back on track. So Dr. Mona Orbab is from the Harold C. Simmons Comprehensive Cancer Center. She's the Associate Program Director of Medical Residency, Radiation Oncology, Radiation Therapy for Breast Cancer. And she is Assistant Professor of Radiology at the UT Southwestern. She earned her medical degree from Tehran University of Medical Sciences in Iran, where she was awarded the Dean's Award for top-ranked medical student. She completed two research fellowships in both radiation biology and immunology at Harvard Medical School, where she received the Ruth L. Kirkstein, I think that's how you pronounce that, National Research Service Award, the NRSA T32 grant, followed by an internship in surgery at Brigham and Women's Hospital in Boston. She went on to complete her clinical training in radiation oncology at India's University Radiation Oncology Program and earned a master's degree in adult education from Indiana University. Dr. Orbab is part of our breast disease-oriented team. Her work has been published in many journals, including the Journal of Clinical Investigation, Advances in Radiation Oncology, Head and Neck Journal, Applied Radiation Oncology, and this word, I can't pronounce that word, I'm sorry. Y'all can fix it. She serves as a reviewer for Advances in Radiation Oncology and International Journal of Radiation Oncology Biology, Physics in the Red Journal. She was also selected among the top reviewers for the Red Journal in 2020. Please help me welcome to the stage Dr. Mona Orbab.
Kind introduction. Thank you. It's working finally. We fixed it for the last speaker, I guess. That was a very nice and kind introduction. Thank you so much. And thank you for all of you. Thanks all of you for being here. And I know this is the last one, so I try to keep it short and simple so you can all get to lunch. If you want to just remember one thing about the talk today is that early detection truly saves lives. So please don't be scared to ask your physician for early screening. So as you can see here, breast cancer is the most common type of cancer in females. But I just wanted to highlight that men can also be affected by breast cancer. So if you notice any changes in your breast, just see your primary care physician and talk about it. Let's go to the next one. So technically over the years, breast cancer mortality has gone down significantly, and that is because of the great treatment options we have now for breast cancer. So we have so many patients coming and telling us, hey, my grandma died of breast cancer, they couldn't do anything for her. That's not the case now. So we have so many different treatment options. And usually patients come and ask me like how their overall survival is with like breast cancer. And just to highlight, if you have an early stage type of breast cancer, your survival is actually really good. So in 5 years, 99% of patients are living without any issues. If you have a more advanced type of breast cancer, the survival can go a little down, but it's still more than 85%, which is still really, really good. And even patients with metastatic disease tend to live for so many years. Like we have patients who live for more than 10 years, 20 years. So please don't be scared if anyone near you is diagnosed with breast cancer. The most important part for everyone is to do the screening, and the screening usually starts at the age of 40. Different guidelines tell us different about how the screening needs to be done. So one guideline says do it every other year, so just get a mammogram done every other year, and then another guideline says to do it every year. So both are options, and it's just like an X-ray, so it doesn't really cause cancer, it doesn't really cause any problem to you, and it's like a very quick visit. It takes less than 10 minutes to get it done. There are some people that are more, the recommendation is for them to get MRIs, and those are people who have like implants, who have dense breasts. So if you have a dense breast, usually in your mammogram, they say, hey, you should just get a breast MRI done to help find lesions better. And there are some patients who are high risk, like having family history, problems like that. So if a physician recommends a breast MRI to you, just get it done.
Sir, there's a wasp, and it's making me very nervous how close it is to you, or whatever
okay.
that is.
Yeah, sure. There we go. Thank you, Mary. And then not everyone needs to get a breast MRI because there is, some high false positive rate, meaning that you might not have any lesion and a breast MRI might show something. So it's not really recommended for everyone to get a breast MRI because you end up having so many biopsies done, and sometimes it's unnecessary. And then sometimes some females need to get an ultrasound done, and that is something else to know about. It's, again, a very easy thing to do. It takes really a few seconds. And breast cancer, is very important to know if you have breast cancer, what stage it is. So whenever someone is diagnosed with breast cancer, if it's like a bigger tumor or if there are positive lymph nodes, they do additional imaging to screen the lungs, liver, bones to make sure the tumor has not spread to other areas. And many, many years ago, the only option for female with surgery was to undergo a mastectomy, meaning that they would remove the whole breast out. Nowadays, not all patients will need that, so most patients can just undergo a very small surgery called a lumpectomy, meaning that they just remove the tumor out. But if someone qualifies for a mastectomy and the whole breast tissue is out, there are still options for reconstruction. So they can put an implant there, they can use their own tissue and move it up. So there are so many options. So it should really not affect the cosmetic outcome. And this is the lumpectomy. I think the image is not showing well, but technically it's just removing the tumor out and not removing the whole breast out. And nowadays, as I said, we have better options for treatment. So we technically do surgery. If a patient needs chemotherapy or immunotherapy, that is done. And also radiation is another tool to make sure the tumor is not coming back and the survival is not affected. No? Guess. Oh, no. So in order to do the surgery, there needs to be seeds placed in the breast so the surgeon can technically detect the area the tumor is. And also, they always sample lymph nodes underneath the armpit area whenever that is done. And in order to detect those lymph nodes, they basically use a dye that is injected into the breast to find those lymph nodes. And this is something done at the time of surgery. So patients who have lumpectomies done, they usually have 2 incisions and they're like very, very tiny. And then the radiation treatment usually happens after the surgery. So we basically have the patients treated, just as was explained earlier, using machines that you can see there. So we basically target the breast only, so all organs nearby, including the lung, heart, they're all spared from receiving radiation. And we have really good techniques to do that. Sometimes we ask patients to take a deep breath and hold it during radiation. That way we'll spare both heart and lung from receiving radiation. And it's just like an X-ray or CT scan. You don't see anything, you don't feel anything, no radioactivity, so you can be close to whoever you want. You can hug kids, babies, do whatever you usually do. And this is just to highlight how the heart sparing is done, so you can see the heart, and if you don't have the breath hold, basically part of a radiation is going through the heart, but with a breath hold, we're really good at sparing the heart from receiving the radiation. And now we are getting better and better options for treatment. So for certain patients, there's no need to receive radiation to the whole breast and to deliver radiation to the whole breast. So we are just delivering the radiation to the area the tumor used to sit in with a margin around it, and that is called partial breast irradiation. That helps a lot with sparing organs nearby and also decreasing the fibrosis and scar tissue formed from radiation, so we end up having a better cosmetic outcome. And also in case a patient needs further radiation in the future, because we haven't done the radiation to the whole breast, we have that option later too. So this is just showing how that is done. We basically find the tumor bed. Our surgeons are usually the ones who put some clips in there for us to be able to detect the area the tumor used to sit in, and then we add a margin to it and then deliver a radiation to that specific area. And we have two different ways of doing this at UT Southwestern, and we are very fortunate for that because we're the only institute that has two of these machines at the same place. So one of them is called GammaPod that you can see in this picture. So basically a breast cup fits the breast, it gives it a suction, so it pulls it away from all nearby structures, and the patients are treated on their bellies, laying flat, and the radiation comes from down to up and basically treat the cancer cells in that area. And that is like a plan for that. So you can see how we basically try to deliver the dose just to the area that the tumor used to sit. And then we have another machine called Ethos. It is the exact same type of treatment, but this time patients are placed on their back with their arms up, and they go through that tunnel that you can see there. And again, we basically do the same treatment on this machine as well. And now we are doing more and more trials to figure out how we can spare more of the breast tissue from receiving radiation, and maybe in the future not having patients do surgery, so we can just do the radiation and patients will be done and they don't even need the surgery. So this is a trial happening at our institute that we give one single dose of radiation to the patients prior to surgery. And right now we are in this phase that the patients still need to go for surgery because we want to make sure the tumor is gone. But in the next few years, hopefully we'll be able to just do that and spare the patients from undergoing surgery. And that is exactly the same thing that I talked about. And also with systemic therapy, so you might have family members who have gone through this and they have received chemotherapy. So there are different indications for that. Usually that is given to patients who have like a locally advanced type of tumor, meaning the tumor is big or there are positive lymph nodes, or they might have undergone a genetic test called Oncotype, which is done on the tumor itself to detect the chance of it coming back in other locations. So if someone has a high Oncotype score, they're more prone to developing metastasis and disease in another area, and what radiation does is just having a focal treatment, so we're just treating the area we need to treat, so we are not treating the whole body with radiation. So those patients will eventually need to undergo chemotherapy. And there are some patients who have triple negative disease, meaning that their hormone receptor status, like the estrogen, progesterone receptors on the breast tissue are not there, or they have HER2 positive disease. Those patients have the option to undergo immunotherapy type of treatment, so those patients also receive a systemic therapy. And usually the side effect that everyone is concerned about is hair loss, so that usually happens with systemic therapy. Radiation does not cause that. And we are going through a phase that we are using DNA to figure out if someone has a recurrence, because you always do the treatments and you're just worried that this can come back and affect the patients in the future. So now the technology is allowing us to basically look at the DNA of the tumor in the blood. So some patients undergo blood draws every few months, so they can technically look for the DNA of the tumor in their blood. And if that is present, that patient has a higher chance of recurrence in other areas. So we can basically do more imaging to figure out if that is the case or not. So this is also an option. So something maybe to discuss with your physicians if you've had breast cancer and might be qualified for this. And that is basically it. So this is our department. We are located on Inwood Road. Both buildings are dedicated to deliver radiation. And as I said, we have the highest technology. And I'm available for questions afterwards if you have any question. And we have our social media pages there. And Mary, who's sitting right here, is the director of our social media. So she would love to see you follow us, either on Twitter, Instagram, or Facebook. And we always provide the most up-to-date updates about our department, the new technology we have, and if you have any questions, you can just send a message to us there. And thank you so much for the time. I appreciate it.
All right, thank you guys again for your attention, and thanks to the great presentation on breast cancer. By Dr. Erbab. Has she left? I know she had to get out of here. Oh, there she is. Dr. Erbab, here you go. We want to make sure you have a little something to take with you as well. Come on, y'all clap your hands for Dr. Erbab. Thank you so much. I appreciate you coming. All righty. All right, we're gonna move right along. We're gonna move into our lunch session. We're almost on time for lunch, which is gonna put us on time for the rest of the day. Listen, so lunch is gonna be served when you go out. It's gonna be to your right. Some of the items are self-serve. Some of them will serve you from the window. There's some tables in the vendor area where you can sit and eat. You can eat out in the foyer. There's a couple of rooms down the hallway. You can sit and eat as long as you can be comfortable. And then when you get done, we're going to come back in here and we're going to finish out the day with our friends from Telex and from Promise. And then we're going to have our wrap up with our awards presentation, scholarships, the raffles, and the giveaway. Now, did everybody get a raffle ticket? Who did not get a raffle ticket? See, Ms. Moore. Ma'am, Ms. Wright, Sister Wright, can you get my friend, Ms. Moore? That is my good friend and her husband, the Moores. Ms. Moore is one of the counselors at Young Women's STEAM Academy. And the first day we met, we clicked. And let me tell you something. Don't ever give her a mic, because she will wreck the house. She is a preacher's preacher. Do you hear me? And I came behind her at a funeral. I'll never do that again. Amen. But she is certainly an anointed woman of God, and she has supported everything that I've done from the day we met. And then she's the person that if I'm going through, she's like my big sister, my big little sister, because I'm older than her too. I seem to be older than everybody. Jeez Louise. But she's like my big little sister. I can go in there, and if I'm going through, I can talk to her because she's going to give it to me straight from the hip. And sometimes that ain't always good. Sometimes I leave out of there like, I should have never went to Leslie's office. But I leave out there so refreshed. So Mr. Moore know that she's doing a good job, not only counseling children, but counseling big children like me. Amen. So once again, thank you to all of our vendors and sponsors, Methodist Charleston Hospital, and Telex and Parkland Hospital, the American Cancer Society, Carter Blood Care, UT Southwestern Radiation Oncology, and the Harold Simmons Comprehensive Cancer Center, Forward Vibrations, Foundation of Mental Wellness, Aclinate, Real Recovery, Boston Scientific, Promise, Zero Prostate Cancer, NTA Life. Thank you all so much for helping us to make this event what I'm calling a great success. We had some technical issues, but the devil is always going to get busy when the Lord is blessing. So I'm accustomed to that. So I want to make sure everybody has a raffle ticket. Every vendor table has a we can win QR code on it. If you want to purchase some more raffle tickets, all you have to do is scan that QR code and make a donation of $20. We'll make sure you get 5 more raffle tickets. We have a barbecue grill. Oh, we have the side trays too. We just had to take them out because they didn't give it to us in the box, and I was tearing up a new car with it, so I took them off. So we got a barbecue grill right there, and we got a 43-inch TV right here. We have American Cancer Society T-shirts and mugs with those guys they call the cowboys, I guess. If it ain't the Saints, it got to be the Aints. And we have a cooler right here that we're going to raffle off, and then NTA has a 43-inch TV that they're raffling off back there. I think you have to go back to their table. They'll give you a raffle ticket once you sign up. All right? Sign up. You don't have to pay, but sign up. We need your help, and we can win. So if you can make a donation to our organization, we're a nonprofit 501c3 in the state of Texas. We're in the process of filing for federal 501c3 because God is taking this thing to another level. And I'm really getting ready to retire for real because I can't do what I do and then do this too. And I got too old for this stuff. All right, so I still got the key to the house. Mess around. That's a girl right there, something else. But to all of you all, thank you all so much, man. Y'all made this. Look, I've been having conversations with people all week long, you know. I'm not calling no names, but I have conversations with people all week long. I'm doing everything I can do. I need my relatives to be there because they need to hear this. And da, 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 da. I'm like, okay. Just tell them to come on then. Look, when you walk out of here today, your life will not be the same. I guarantee you. Yeah, you're going to have bad dreams of this thing. But these bad dreams are really good dreams because you're going to leave out of here encouraged. If you're going through prostate cancer, if you're a caregiver, and while we at caregiver, since I got about 5 minutes before lunch, while we at caregiver, let's acknowledge these caregivers because they're the real goats. That's the real goats, man. Those caregivers, they have to see, especially if you're in late stage of any kind of cancer or any kind of sickness, dementia or whatever. These are the people that sit by your bed and watch, maybe not by your bed, but they sit by the bed of that client or that patient, and they take care of them. They make sure that they eat, take their medication. I know my sister just lost her husband, and she did that for 14 years. And caregivers get to a place where they'll take care of the patient and forget to take care of themselves. So I want you caretakers to know that you are respected, you're acknowledged, you're loved. We're praying for you because you are the guys that make sure that we get everything we need. I'm telling you, when I went through my procedure, my pastor was there, as he always is. And I'll tell a quick joke, and then we're going to go to lunch. My pastor was there, and I had gone through the procedure. And, you know, I thought I was a tough guy. I had 75 milligrams of fentanyl during the procedure because it's sort of painful. No, it was real painful. And so 75 milligrams of fentanyl, and when they let me go, told me I could go home, I went to the little changing area, and my pastor was standing there with me. He said, "Bishop, do you need me to help you put your pants on?" And I was like, "No, man." Good thing he was there because that floor would have caught me, right? And so I get home, and my wife and I hadn't gotten married yet, but she came over to fix dinner for all the people that were going to be there that came to visit me. She cooked a little heart out, and she told me the next day when I talked on the phone, she said, I don't know what you were talking about, boy. Whatever it was, you better be glad I was the only one that heard it. Because that fentanyl had me on the road, right? And so I'm so grateful to all of you. Thank you to all of my new friends, my new brothers and sisters in this race to cure prostate and breast cancer in our communities. Thank you to all of these wonderful doctors who volunteered their time to come and give us this good information. Yeah. I appreciate y'all. And then Telex is going to come after lunch, and they're going to talk about what they do. We have a plethora of information to send out here today. And then my friends from Promise. Anybody ever had genetic testing? Yeah. Look, I got convinced. Natalie convinced me to have genetic testing done. And I talked about it. I'm like, that girl, I ain't doing no genetic testing. I'm just going to tell her I'm going to do it so I can, get off this call because she's trying to convince me that. But let me tell you something. I'm glad I did it because now I know that I have no underlying issues. Some of us, especially in our community, because of all the different diseases that our community has to go through, diabetes, hypertension, blood pressure issues, prostate cancer, this, that, and the other, we need to know that it's a possibility that we're in line for stuff like this, for any kind of disease. So genetic testing is going to help us. They're going to help us. All right? Let's see. All right, so we talked about lunch. We talked about the raffle tickets. We talked about donations, stuff like that. We are also, I'm also extremely grateful that we have 2 different hospitals represented here. Actually, 3 different hospitals represented here. And that being Methodist Charleston Hospital and my friend Patrick Clark and the Parkland Hospital folks, and then, of course, UT Southwestern. Now, yeah, come on, clap your hands for these hospitals. All right, so look, as we grow, we're learning. As we grow, we're learning. And we want to make sure that next year we want to have as much information put out by these hospitals as possible. And so right after lunch, I'm going to ask my friend Patrick to come and just have a few words about what Methodist does. Is that all right? Can you come and talk to us about your cancer program? Because I did not know. I feel bad about it, but we want you all to know with these different. Come on, UT Southwestern, they can't take everybody. Come on, but Methodist is there. Charlton Methodist is there. We met last year at another event at Community Baptist Church, and so I want to have Patrick to come and talk a little bit about what the services that Methodist provides as well. Is that all right? All right, I appreciate y'all. All right, so we're going to go to lunch, and we're going to come back in here at about 1:15, and then we'll do the first raffle, and then we're going to get into the last few speakers, and then we're going to raffle off the rest of this stuff and going to go home. All right? If you have questions that you are not able to ask our doctors, here's what I'm going to ask you to do. If you go to our website, www.wecanwinpc.org, www.wecanwinpc.org, our contact, if you go to our Contact Us page, if you will send me your questions, I will get them answered for you, guaranteed. I'm not going to ignore it. If you send me your questions, I'll get them answered. Is that all right? You must have a working email address. All right? All right. So email me your questions. We wanted to do this on Zoom, but we had some issues. Next year, I've already made it up in my mind. I'm going to speak it into existence now that we're going to bring in an audiovisual company next year to stream and broadcast. This is important that it goes everywhere. All right? All right, so that's it. We're going to go out to Shay. What do you want him to come out of? Ma'am? Did she ignore me? Oh, because she ignores me a lot. Her feelings get hurt. All right, so I guess we just go out the back door and just go around to the right, all right? And then we'll have lunch and we'll come back in here at 1:15. All right? Thank y'all. Appreciate it. Don't forget, you want to make a donation to Weekend Win, it's tax deductible. Scan the QR code on one of the sheets and send it on. Hello. All right, all right. We're gonna keep on moving. Let's see. Iverson, I need Iverson to kick this live broadcast back off. I'm not sure where he is, but if we can get everybody to move back in here so we can move on. Yeah, we can get these folks to come on back so we can move on. I need my son so he can get us back live. Whew. Lunch was pretty good. Thank you. All right. Hey, Iverson, is something that we need to do to go back live? Let me see. All right, so hopefully everyone had a decent lunch and you all have a raffle ticket. If you don't have a raffle ticket, let me know so I can get you at least one. If you need to purchase more, let us know and we'll get you a QR scan code so you can scan it and purchase some more raffle tickets. All of your purchases go directly towards We Can Win and gives you an extra opportunity to win some of these fabulous gifts that we're going to be raffling off. Can somebody get Lady Shay, because she has all the raffle tickets. I need her. All right, so we're going to do a quick raffle, and then we're going to present these awards. Some people have to leave, I understand. And then our scholarship winners, one of the scholarship winners on the way because it's graduation weekend, a whole lot of stuff going on at these high schools, and then Taraya is graduating today, so she couldn't be here. So we're going to present her a little bit later on. All right. So once again, thank you all for being here with the Together We Win 2024 Symposium on Prostate and Breast Cancer. I'm really hoping that you guys have gotten a lot out of the doctors that presented today. We also have a couple of vendors that are going to come and share a little bit about what they do and try to continue to enhance what we do here at We Can Win. All of our vendors and sponsors, I'm really grateful that you all saw the vision and caught hold to it. Most of you all came on board with no hesitation at all. You heard the story, you heard my story, and about what we're attempting to do. And you came on board to make it happen. And because of that, this was the best audience that we've had in these past, this is our third annual symposium. So the last two symposiums, this is the biggest audience we've had. And I'm just going to continue to believe that we're going to have 4 or 5 times this many people next year. I believe that we're going to be able to, thank you. I believe that we're going to be able to fill this space. I've spoken with a couple of you guys here, and you're going to work with me to get our churches involved, because no seat should be left empty in these kinds of forums. So a couple of folks are going to reach out to different church organizations, and let's see if we can get these churches involved in our community to do a work and make a difference in our communities. All right, I'm waiting for, can somebody get Shay in the, there she comes. She just ate too. I guess she's just strolling along. Oh, you didn't eat? You poor baby. All right. Can we get the raffle tickets up here? Everybody got a raffle ticket, right? All right. So, here's what we're going to do. Weird. I call it weird. She called it tired. What was I going to say? Oh, also, you guys make sure you stop by Carter Blood Care. Quick fingerprint will let you know, finger prick will let you know what your blood type potential is, and they'll share some other information with you about donating blood at Carter Blood Care. How many of y'all know that we need more blood at Carter Blood Care, because in the African American community, we are running short, unfortunately. So let's connect with Carter. And then be sure to stop by and speak with all of our vendors. Miss Right Hand, I need your assistance. I really do need your assistance, home girl. Okay. All right. She coming? Ma'am, can I get your assistance? Yes, hunty. Come on. If I was taking a shopping, she'd be through that door already. Huh? I want to know where she wants to start. You know, she called these shots. I'm just here. All right, I'll tell you what we're going to do. First thing I want to do is get rid of these, get rid of these, what do they call them? What do they call them? Cowboy. Oh, they still got a team? When the last time they went to the Super Bowl? Hold on. The only way they get to watch the Super Bowl is on the DVD. That's what I heard. That's what I heard. That's what they told me. I don't know. All right, so this is a really nice cowboy mug for you cowboy lovers. And I'll call out, I guess I better call out all the numbers, because some of these numbers may not coincide with what we're doing. All right, everybody ready? Oh, I got to throw some back. I already got a ticket out. Throw them in there. They must be cowboy fans come late like that. Oh, that's my sorors. Bless y'all beautiful final women from Zeta Phi Beta Sorority Incorporated. I know y'all was going to do that. I love it when y'all do that. All right, here's the winner. 529034. There we go. We got a winner. Winner, winner, chicken dinner. All right, let's try to get this other one into somebody. Now listen, if you ever want to be a Saints fan, just let us know, okay? She not paying me no attention. See, that's like a cowboy fan. If you ever want to become a Saints fan, let me know, okay? All right, here we go. Five 529-021. 529-021. Must be present. You got it? You got it? All right, from the Zeta Mill Network. Come on now. All right, bring me that ticket so I can make sure. All right. That's it. Same conversation. If you ever decide to become a Saints fan, let us know. Huh? That cooler. All right. So look, here's a nice little cooler. I know nobody here don't drink beer, but you know, hater. I drink a lot of that, right? All right. This is a really nice little cooler in case you're out somewhere, you want to keep yourself cool. It'll keep ice for like 2 days. They need to hire me. I make a good publicity guy. All right, come on here, Sora. Did you get a raffle ticket? Tell them you need a raffle ticket. Oh, Sora, that's the big shot Zetas. You better get him a raffle ticket, girl. The big shot Zetas. Let's make sure they get a raffle ticket. Y'all stay right there. She gonna get y'all a raffle ticket. They had a lot going on today, so they're coming in. I thank God for them coming. My sisters from Zeta Phi Beta sorority. Thank y'all for coming. I was at their event last week? 2 weeks ago. My goodness, Stark's Nest. Man, they raise money and stuff for expecting mothers. If y'all want to donate to their organization to help out an expectant mother, y'all can see any of these fine ladies in blue, and they'll help you out. Okay, here we go. Oh. Y'all see what I got to go through? This is every day of my life. I got to go through this. I say go, she say no. All right. We finna get to the big stuff, and then we gonna move on to the awards, and then we gonna hear from our other people. All right. Here we go. Don't do that. All right, ticket number 529023. There we go. We got a winner. Keep that haterade cold. All right. Let's do these big ticket items. Let's do these two in front. Yeah. All right. Everybody got a ticket in here, right? All right. Here we go. Huh? Somebody say, Pick your number. Look, y'all know I'm a Sigma. I can't be doing that. I mess around here and get sued. And I already ain't got no money. All right, for this 43-inch television, the winner is... Oh, this is my ticket. I know, I ain't gonna start nothing. All right, 529002. I think this person left. Huh? Oh, the last number got, okay. 52902. I can't read the last number. Oh, the last number is 4024. Who we got? Okay, my friend. There you go. Yeah. You go home and tell all your friends, girl, y'all better come to this thing next year. They give away good stuff. All right. Wait, ma'am. This says 026. Oh. All right. We got this barbecue grill. Now, here's how this go. Now, whoever wins the barbecue grill got to invite us over for grilling. Don't invite me over for grilling if you don't know how to grill. So, in order for me to get this in my car, because they didn't have it boxed, this was donated by our partners at Lowe's over on Hampton. But the shelving is right here. The screws are right there. You just put it on the side. Y'all know how to do that. And then buy a propane tank. Just don't kill yourself. All right, y'all ready? Good Lord. Now, if you're a vendor, if you're a vendor with a ticket, you don't count. I'm just kidding. Jesus. Y'all get all excited. Y'all say barbecue grill, they get crazy. All right, here we go. 529035. 035? 035, that's you, Bill? Go get that ticket. That's my friend Bill. All right. From Reels Recovery. All right. I ain't coming, Bill. I ain't coming. We'll catch you at the retreat. All right. So we'll figure out how to get that to your car. Okay, so let me ask you all this. Let me have that. What size shirts are those? What size is that first one? The gray one. Yeah. 2X. All right, so this is a 2X shirt. Right? 2X shirt. The American Cancer Society donated these to us. Now, look, if I call you your number and you're not a 2X, don't be, find somebody to give it to. Don't be coming up here trying to see, well, let's see if y'all got my size. We ain't got your size. No, I'm just kidding. So we got a 2X, and then we have, and 2 larges, and 1 extra large, right? All right, so we got extra large, 2 larges, and a 2X. So you can choose whatever size you need. Here we go. 529-065. That's I tried so wrong. I tried. It just wasn't in the cards this time. What size you want, darling? I guess the large. The large? All right, grab you a large, darling. I got you. I got you next time, okay? I got you next time. All right. Here we go. Go, we got to move. 529-041. Okay, Miss Norwood. That's my colleague from Young Women's STEAM Academy. She teaches special education, and boy, she knows what she's doing too. My friend, that's my friend right there. We are the ones that make things happen at YWSA because they don't play with us because we don't play with them. We just say what we say and do what we do to make it happen, to make our kids more successful. That's what teachers are supposed to do. All right, here we go. 529-036. All right, Parkland Hospital in the house. We got a 2X and we got an extra large. All right. Now somebody gonna have to take this 2X home and give it to your boyfriend, your husband, your neighbor, or somebody. I ain't taking it home with me because I can't fit it. I'm just saying. All right, here we go. 529-030. All right. Now, NTA, where did they go? Oh. Okay, so we'll wait. Yeah, we'll wait. Yeah, we can do that. All right. Okay, so look, that's the raffle. We got one more to go that NTA is gonna do. They have their own raffle tickets, so you all should have gotten. If you signed up with them back there, you get a raffle ticket for another 43-inch TV. All right. Okay, so look, we want to move on. This year has been a first for so many things that we've done with We Can Win Foundation. God opened up a door for us to have an international presence this year, so we now have a presence in Toronto, Canada, and we're working on a space in Kenya, Africa. I'm always that guy to reach for that which is that much taller than I am, and y'all know it don't take much to be taller than me. Ma'am. Thank you, sister. Thank you. That's my other sister from another mister. Now you talking about will correct me? Ooh, I think she think that my mama really born her. So anyway, we're reaching out now to expand the We Can Win Foundation into the nation of Africa, because in doing some research, I'm understanding that in Africa, because they don't have the same access to health care, they don't even know how many men are suffering from prostate cancer. And so we're reaching out to some of our friends and some of our counterparts to see if we can get that data, to see if it's going to be worth us going to Africa and talk about prostate cancer. And so that's our next move, is to move into that space in Africa. So you all keep us in your prayers. We're going to keep doing this until we can make sure that this disease is known worldwide, that there is a way to cure it. All right? All right. So y'all that can pray. All right. Y'all want to do the last raffle now? You ready? Okay. Sora, you got the tickets? Yes. These are the newlyweds. Y'all clap hands for them. These are the newlyweds. Amen. All right. Now, this is just for y'all folks that follow directions that signed up. Some of y'all didn't sign up because y'all thought y'all going to have to swipe your credit card. I told you I wasn't going to cost you nothing. It's too late now, brother. It's too late. You must be a Cowboy fan. Okay. I'm going to get in trouble for this, I tell you. All right. So NTA is an insurance company that deals with folks that are dealing with prostate cancer from the financial side of it. All right, so you all should have a conversation. If you've been diagnosed, or you have the potential to be diagnosed, or if you've had prostate cancer even for 5 years, they're the only insurance company in the U.S. that will give you that type of insurance even after 5 years in, right? Because look, when you have prostate cancer or any kind of cancer, you never know what's going to happen, right? I mean, even with me, I'm taking steps now because I'm not scared, but I'm taking steps to prevent my family from having to go into financial trauma if something was to happen to me, right? Or even to prevent me from going through financial trauma if something happens as far as cancer is concerned, or anything else. So you guys need to talk to the folks over here at NTA and see what they got going and make that thing happen. I'm going to have the conversation with them because now it's time for me to have that conversation. Why is that? Because I have a 16-year-old son that's getting ready to be a junior in high school. I have a 21-year-old daughter that's getting ready to be a senior in college. I have grandchildren. I want to make sure that they are all well taken care of. And then, of course, my wife, I told her that I'm not leaving you anything because I'm spending all of my money the day before I die. See, she ain't never listening. She missed out on that one. Anyway, I want to make sure that she's well taken care of whenever God decides to call me to glory. I want to make sure that my children and my grandchildren are well taken care of. And so now I'm in a space where I want to build financial wealth for what's to come behind me. The Lord has allowed me to live a relatively good life, so now I'm trying to make sure that they do the same. All right, here we go. Y'all got one of these, right? Brandon Rogers from the Zeta Male Network. That's what I'm talking about. See? Tell them other brothers from the Zeta Male Network they should have been here. Thank y'all so much. Brother Iverson, are you getting pictures of this? We need some pictures of these things with these gifts and these raffles. So let's make sure if you're a raffle winner, make sure you see my son so he can get a picture. All right? Make sure he gets a picture. When this is over, I'm going to ask all of my blue and white family to gather with me up here on the stage so that we can get a photograph and put it out in our network. All right? And then hopefully we've gotten pictures with all the vendors. And then here's what I'm going to do. Because I'm still famous and folks are still asking for my autograph, I'm going to go on this side. Iverson, pay attention. Iverson, who's that you talking to? Rashid? Listen. Come here. Come here, sister. Come here. Because we finna move on. I ain't finna play with you. How rough I take my belt off. Listen, sometimes there's a chance meeting of a person that you fall deeply in love with. I'm not talking about that kind of love. I'm talking about a brother-sister love. And I met this sister when we were in carrier school for the Postal Service. And when we graduated, she catered lunch, and I was like, Jesus Christ, this girl can cook. Man. And so, as luck would have it, we got assigned to the same post office on Cedar Ridge. I told Rashida she came in there the first day, she was cute. Shoes, cute. I said, baby, where you going? We finna carry mail, boo. You can't carry mail in them shoes. She told me, Bishop, I'm a G. I said, okay, G. Say you carry mail with them G shoes on. About 2 weeks later, here come Rashida. I saw her with this envelope. I said, Rashida, what is that? That's my resignation letter. I said, resignation, baby, you ain't been here for 2 weeks. She said, Bishop, I got blisters all on my feet. I said, because that was you was trying to be cute. Letter carriers can't be cute. And so she left, and we ran into each other a little while later. I think I watched on Facebook. She was developing her brand. She had a restaurant, a brick and mortar restaurant at the time. And I said, well, she cooked that good for our graduation. I'm gonna have her to cater my wife's 40th birthday. She shut her restaurant down, and she had a private, what do you call it? Birthday party. I'm tripping. I get excited. We had a private birthday party for my wife that Rashida catered, and let me tell you, people are still talking about that food today. That was 4 years ago, and they're still talking about that food today. And so she has done so much. She started the culinary art program at Duncanville High School. So started at Cedar Hill and went to Duncanville. Okay, whatever. And she also hosted a private birthday dinner at my house for me in February. Baby, if you ain't never had shrimp and grits, you need to holler at her. Because them shrimp and grits wasn't nothing nice. When you can sit down and eat like I ate and then sit back in a chair like this, yeah, you good and full. I had some the next morning for breakfast too, trust me. This is Rashida Johnson. We call her the real Chef Duke. And one of the best, she doesn't really like catering because she does private affairs. She was on the executive chef team for TD Jakes for a couple of years. And so she ain't no chump. And so look, let's support our black businesses, right? Let's support our black businesses. She has a daughter. She has a couple of kids, but she has a daughter I fell in love with. I call her my Light Bright. Well, Light Bright has kids now. A kid.
I have a grandchild.
One. A grandchild. Yeah, that's because she's a spoiler, all right? But thanks, Rashida. I called her. I said, sis, I need you to cater my event. No argument. No argument. Except, that's all right, I'm not going to tell him that. But thank you so much, sweetie. I love you. You know I love you. And I know she loves me. And I really appreciate it. Okay, we want to move into the awards. Okay, so you all have heard me talk about this young lady throughout the day. I told y'all that a lot of this stuff this year is inaugural. It's our first scholarship, our first 2 CEO awards and stuff like that. And y'all heard me talk real good about her this morning. She has become my sister, and she don't pull no punches when it comes to my health. And she'll fuss at me like she really be meaning it, I believe. And I wanted to honor her because since 2021, Tamara Dickinson has, well, actually, no, since 2017, Tamara Dickinson has walked this journey with me day in and day out. If I text her, she texts me back. If I call her and I miss her, she'll call me back. If I email her at UT Southwestern, she answers my emails because she's concerned about me. So let me tell you something. You know, a lot of people have asked me, well, right, every time you have these things, we'll never have black doctors, we never have black representation. That's because I call them and they don't show up. Just want y'all to know that. But these people that come to speak to us and to help us to understand prostate and breast cancer, they may not look like us, but baby, they're concerned about us. So this is the Real Talk, We Can Win Real Talk About Prostate Cancer CEO Award presented to Tamara Dickinson. Now watch this. MSN, APRN, AGPCNPBC, CURN, CCCN. I need an asthma pump after. Tamara has done her thing, man. She speaks at symposiums and conferences everywhere. I just love her to death. She invited me to come this year. I was a vendor at the Cowtown Nurses Association Symposium. I thought I was all that. I say, man, I'm going to be a vendor at the Cowtown Nurses Association Symposium. They're like, boy, you need to go sit down somewhere and talk about the Cowtown Nurses Association. But I was there, and it was because of Tamara. So, Tamara, this is for you from the Together We Win Symposium 2024. We love you. Let's make sure we get some pictures. And don't be bossing my brother when you get home either. Yeah, she does. She really does. I think she learned it from you. Come on, let's give her a hand. All right, so this next CEO award, y'all heard me talk about her earlier as well. Mary Whitmore has been on board with us as well since the very beginning of the We Can Win Foundation in 2021. She's been an advisor, she's been a confidant, she's been a friend. She's been a person to make sure that when I'm putting stuff out there, it looks right, it sounds right, especially when I'm representing UT Southwestern and the Harold Simmons Center. And, you know, I happened to send out something twice with the wrong thing on it, and she sent me an email. She says, I think you sent the wrong flyer out again, Dr. Wright. I had to go back in and get the right stuff and send out the right stuff. But I love that about her because she's not going to let me put out anything that is not 100% correct. She know I'm a first-class guy, and she's going to make sure that I stay first class. So I'm believing God for a very long-term relationship with UT Southwestern and with my friends. And again, we've all become like brother and sister. I'm excited about the relationship that we have. And so Mary Whitmore, this CEO award is presented to you, thanking you for all of your support from the Together We Win Symposium 2024. Mary Whitmore. We're almost done. We're almost done. I'm going to get to these other two speakers. This is a very, very special award. I was laying in my bed one night, and I was thinking about all the trauma that caregivers go through. And I met this couple way back in, I think, 2022, and we became really good friends. And I've heard their stories. They've heard my stories. We've advocated together in Washington, D.C. on the Hill. They are very passionate about prostate cancer and finding a total and complete cure for it. But more than that, they're compassionate about helping others who suffer with this disease. And so we came up with the idea of having a combined award, because they're a married couple, and I tell you, I know for a fact that she not only takes care of him, but he takes excellent care of her as well. And so I want to present this year's award, the Survivor Caregiver Award, to Jeff and Tammy Holbert, my good friends. Thank you for helping to eliminate prostate cancer from the Together We Win Symposium 2024. Yeah, you want to take that with you, because Tammy's fingerprints will probably be all over it before you get home. All right, so here's the great part. Here's the greatest part of what we do and why we do it from the breast cancer side. A few years ago, my niece in San Antonio woke up on a Monday morning, and she felt a lump in her breast. She decided she better go to the hospital and see what it was all about. By the time Friday came, that breast cancer had turned into like 4th stage breast cancer in less than a week. This is a woman who was active, who sparred with some of the best boxers in the country, had a very active life, was a mother, and then all of a sudden, breast cancer. But she beat it, and she's well. And she has 3 great sons and my nephew. But then I met a woman a few years ago. I heard her story. I wasn't involved like I am now, but I heard her story about surviving breast cancer. Not only that story, but I watched her life, and I watched her go through so many issues. I watched her go from a walker to knee surgery on both knees and back on a walker. And I told her, I said, you know what, Mother, one day you're going to run down that aisle and ain't going to need no walker. And one Sunday evening at a service at Higher Mark, I saw her come down that aisle without a walker, healthy and dancing and shouting and giving God glory. And so when I really started to understand her story, I found out that she was a breast cancer survivor. So I told my wife, this year, let's honor a couple of breast cancer survivors. Because, you know, we can say what we want to say about Susan Komen Foundation and all these other breast cancer foundations that are around. I've not seen yet, and I may be wrong, but I've not seen one yet that honor in our community. And so we want to honor this sweetheart today. I introduced her earlier. She's about one of the feistiest people I think I've ever met in my life. And we fight every Sunday. My wife is an armor bearer, and she will talk crazy like, Mother, I don't have time for you today. Where's my belt? I'm looking like, Mom, I'm 62 years old, 69 years old. She don't even care. Where's my belt? She was trying to. So this year, we want to present to Dorothy Anderson our very first Pink Butterfly Award from the Together We Win Symposium 2024. Go here by your daughter.
Oh.
Bless you,
I want
mother.
to tell them about breast cancer.
Okay.
I just want to say something real quick, please. I just want to know, I want everybody, because when I was diagnosed with breast cancer, I had no signs. The mammogram caught it. And then it caught it at a 0. I hadn't went into the stage yet, but I did have to have surgery and all that. So I'm telling everyone, please get your mammogram, because it will save your life. I was 66 years old when I was diagnosed. Now I'm going into my 80th year of my birthday. So please get your breast cancer.
All right. Also, Mother, I want to give you this book. It's called Hiding Behind the Mask in the Corporate Closet with Cancer by Kay Holloman. Just a good read for you when you have time, okay? All right, last one before we move into these scholarships, because we got to move and we got to get these other speakers up here. Some years ago, when I entered into the blue and white world, I met some very interesting people. And, people tend to talk against fraternities and sororities, not knowing what they're talking about. They say we're idol worshipers and this, that, and the other. But let me tell you one thing. I don't care what they say about nobody else, but Dr. Wright loves God. I love God. You don't love God? What's wrong with you? I love him, I love him, I love him. And so aside from all of that foolery, I was able to meet some very, very innovative and creative people along this 3-year journey that I've been a part of Phi Beta Sigma Fraternity Incorporated. But one young lady stood out more than anybody else. I remember when she crossed my daughter, Kim, I think 12, 13 years ago, into Zeta Phi Beta Sorority Incorporated, and we just kicked it off from there. And then she became like family. And I remember when my wife was excited about becoming a Zeta Amici, and she was going through so much trauma because they would tell her, okay, Lady Shay, we're going to have a induction ceremony on this day, and then she'd get excited, and they would cancel it. They did that about 4 times. And I said, you know what, babe, this is not about you, this is about me, right? Because I'm bold and I'm outspoken, I say what I got to say. It is what it is. Either you deal with it or you don't. And so I said, you know what, wait a minute. I said, let me call Miss Rogers. I said, because if anybody's going to get you into Zeta Amicus, it's going to be Miss Rogers, and we ain't going to have all this political stuff. I called Miss Rogers. I said, Miss Rogers, here's what we need. Here's what's going on. She was like, what? She said, call me back in 5 minutes. So I gave her 5. I called her back in 10. And when I called her back in 10, she said, have your wife call this number. She's going to need to have her money by Saturday, and she'll be a part of the next Amici induction. And today she's a Zeta Amici in the Upsilon Nu Zeta chapter. And then they have supported a lot of the stuff that I've done. Because of Ms. Rogers, I was able to speak at the Zeta Regional Conference to the Zeta Mill Network a few years back. I was able to speak at the Stork's Nest a couple of weeks ago. And my wife came to me after that And she said, babe, she said, Ms. Rogers came over. I'm just going to tell a story. I don't think she'll mind. But she said, Ms. Rogers came over and told me, she says, you know what? I'm a 2-time breast cancer survivor. I'm like, what? I didn't know that. I said, you know what? Let's make Ms. Rogers the second recipient of our... You're going to make me cry. I said, let's make Ms. Rogers the second recipient of this year's Pink Butterfly Award. And so, Miss Eugenia Rogers, we call her Ma. We love her. We respect her. And we honor her today as our second Pink Butterfly Award winner for 2 times as a breast cancer survivor from the Together We Win Symposium 2024. She didn't know this was going to happen. I told her daughter and them we're going to surprise her. Y'all better not say nothing. And they held it. And so her husband is here, her daughter and her son is here. And so, Ms. Rogers, we not only thank you, we thank God for you, for the things that you have done for us, for being a pillar in the society, and especially for being a well-spoken and outspoken member of Zeta Phi Beta Sorority Incorporated. We love you and we honor you today as our Pink Butterfly Award winner. I'm sorry, here's your book as well in your box. Thank you, Sora. And let's do this, and then we're done. We're going to bring these other 2 speakers up really quick, and then we're going to move on. Y'all can see I'm not very emotional, right? That's the devil lying. Okay, hang on, So, we're going to award these scholarships right quickly. Taraya couldn't be here because she's graduating today. But let's clap our hands for Taraya because it's being recorded. She can know we really honor her. I said to God that I want to not only be able to bless in our cancer community, but I want it to be a blessing in our community so that we can help in the educational path of young African American men and women. This young man I have known since I think the 3rd grade. I've watched his life. He is a godly young man, and that's something you don't see anymore in this society that we live in. Single mother raised. You all might have seen him on television as one of the champions of the soccer football team. But what you don't know is not only is Miles Johnson a football player, but he plays lacrosse. He plays in a band. I mean, he does so much until it'll take all day to talk about it. But I want to read you this real quick before we do that. This is Miles' story up until now. Miles was born under Chris Fallsky on November 29, 2005. Miles Anthony Davis was destined for an extraordinary journey. His story unfolds within the inspiring walls of a unique institution, the Barack Obama Male Leadership Academy at Maceo Smith. From a tender age, I have tested, this is in his words, I have tasted the sweet nectar of success. My efforts often bathed in the warm glow of admiration from those around me and punctuated with noteworthy recognition. However, success, as most people perceive it, is often painted in vibrant colors of triumphs, accolades, and celebrations. What many fail to understand is that this vibrant tapestry is interwoven with strands of failure and challenge, elements that have been my silent companions along this journey. Growing up, my mother, a beacon of wisdom, consistently reminded me of the power of embracing my uniqueness and harnessing my individuality. She taught me that true success lies not in being a master of one, but in the ability to diversify and cultivate a range of skills and talents. This vital lesson resonated with me, guiding my pursuits in the world that I cherish the most. As the Bible says in Romans 12:6, in His grace, God has given us different gifts for doing certain things well. This guiding principle has become an integral part of my life's mantra. It has nurtured a burgeoning confidence within me that remains unshaken. Whether I am stepping onto the verdant expanse of a football field, bouncing the ball on the hardwood of a basketball court, standing under the luminous spotlight on a grand stage, or facing an ocean of faces in a bustling crowd. It's through this steadfast belief in myself that I am able to embrace each new challenge and opportunity with unwavering determination and an unquenchable thirst for success. Through various engaging programs, I've delved into the dynamic realms of acting, dancing, and singing, letting each performance tell a story of its own. I learned the rhythm of music, playing in a band, and the art of public speaking. Each experience added another brushstroke to the canvas of my life. This unflinching confidence has also empowered me to take on what others deemed impossible. It drove me to push beyond expectations, beyond the doubts and skeptics, to triumph in areas where success seemed but a distant dream. This was most evident when I hoisted the state championship trophies in both lacrosse and football, a feat that many doubted was achievable in our region. Yet through perseverance, determination, and an unwavering belief in the impossible, I turned those dreams into reality. Those diverse experiences, each unique yet interconnected, have shaped me into who I am today. I hold on to a verse that serves as a daily motivation in Jeremiah 1:5. Before I formed you in the womb, I knew you. Before you were born, I set you apart. I placed my unwavering faith in the Lord, recognizing that only I have the power to determine my ultimate destination. And I look forward to the exciting chapters yet to unfold. This is the bio of Miles Johnson. Miles has been involved as Vice President of the Black Student Union at Barack Obama Male Leadership Academy 23 until present. Student Council activist, Barack Obama Middle School, Barack Obama Male Leadership Academy Theater, Barack Obama Male Academy Jazz Band lead drummer, received 2 back-to-back All-State Jazz Band member. Second place in the DPAC UIL Playwright Competition, received a perfect rating score of 4 at the DISD Visual Arts Scholastic event in 2023, appointed as a tutor for the academic decathlon class to assist my brothers with achieving high ratings for our competition, Barack Obama Male Leadership Academy 2022-2023. A member of the EIF, Education is Freedom Scholars, a program based on high academic ratings that are eligible for certain scholarships through the program. Member of the Call Me Mr. organization, DISD 2023 to present. Second place South Central District Youth Oratorical Contest. First place South Central District Youth Oratorical Contest, March 20 21. First place, Botham John Foundation Oracle Competition, September 21. First place, Southwest Regional Youth Conference Informative Speaking Contest, February 2024. First place, the ETA Lambda Lambda chapter of Omega Psi Phi Talent Hunt, February 2024. Third place, Omega Psi Phi Fraternity North Texas Metroplex Annual Area Talent Hunt, March 2024. First place, South Central District Youth Oratorical Contest, March 2024. First place, South Central District Youth Group Contest, March 24th. Received the South Dallas Business and Professional Women's Club Incorporated Youth Achiever Trailblazer Award, April 2024. Received Best Actor for the 21-22 Black Academy Arts and Letters Summer Musical Institute, granted an opportunity to travel to New York through Broadway Dreams 2021. 2021 Lacrosse Class D Championship. Class D champion, 2023 Class C lacrosse semifinal appearance. Received honorable mention for Bridge Lacrosse Team 2023. Received the Bridge Lacrosse Offensive MVP Award 2023. Two-time UIL State Championship Football for Sock High School 2021 through 2022. Interviewed and featured in D Magazine, March 2024. This boy doing something in our community. Y'all ought to clap your hands right there. Member of the Sankofa Players Teen Theater 2017 to present. Member of the South Dallas Youth Club. Served as local youth club president and district youth secretary 2019 to present. Alpha Emeritus volunteer and participate in community service projects and various events 2016 to present. Member of Alpha Rho Chapter Kudos 23-24. Member of the South Dallas Children's Choir. Had an opportunity to sing with the Scott Joplin Orchestra 2017 through 2023. Member of Life Pack Community Service Group. We create bags of necessities filled with toiletry, clothes, and snacks to distribute throughout the communities 21 to present. Former Cub and Boy Scout of America Troop 5701 2013 to 2023. Participant and volunteer for Project Still I Rise. We explore entrepreneurship concepts, participate in self-career exploration, discussions with career professionals, and discuss financial literacy 2018 until present. Active volunteer for the African American Male Academic Bowl, escorted the youth male participants to their designated areas, assisted with monitoring the academic teams as they competed in various STEM activities 2017 to 2020. Presenter volunteer for the ANAS Journal Writing Project for Boys and Young Men 2023. Volunteer participant annual Harambe Festival 2017-2023. Volunteer Minnie's Food Pantry 2022. Volunteer Buckner Center for Humanitarian Shoes for Orphan Souls 2024. Participant in the SMU Lyle Engineering Summer Program 2019-2022. Y'all can't tell me there's not young black men out here that's accomplishing something in this day and in this time and being raised by a single mother. That should have got a standing ovation right there. Let me try it again. That should have got a standing ovation right there, being raised by a single black mother in this time that we live in. I've been knowing this young man, I think, since he was in the 3rd grade, I believe. He was like the old folks used to say, knee-high to a duck. And now I got a duck to try to look up at him. Miles is in the house with us today. I'm going to ask you to clap your hands as he comes to receive the inaugural Dr. Edward W. Wright Sr. Together We Win Educational Scholarship in the amount of $1,000. My man. Now listen, Miles has been, how many colleges are looking at you now? I think when I talked to Mom, it was 27 at last count. 27 academic colleges are trying to get him. Do you hear what I'm saying? This young man is an example in our black community, to our young men, that if you put your mind to it, if you're determined, if you're persistent, you can do whatever you want to do. However, you must keep God first. And his mom is like my daughter. Come on, Nick, I want you to come here. There you go, Miles. I want you to come here and stand with us. We go back years. This young educator is like my biological daughter. I've got nothing but respect from her over the years. I've watched her educate our young children. Now some of these kids that she educated are now graduating and going to college, and some of them are even coming out of college. So this is one of the reasons when I was trying to decide who we're going to give our inaugural scholarship to, I thought first of Miles. Because like I said, I've followed Miles's life. I've watched the struggles that you've had, but you've always overcome them. I've never, ever heard you complain about raising this young man. And this is the result. And you should be a proud black mother. Thank you, man. All right, now Miles hasn't committed yet because there's so many colleges. I think he's still waiting on Hampton University. Look, when you see a young black man that can play football and lacrosse, I mean, y'all know those that play football and lacrosse. And that boy bad. He wears number 81? 81 for sock. Yeah, the championship team, South Oak Cliff. All right. So thank you all so much for being patient with us. Taraya, we're going to be presenting Taraya's scholarship on the 26th here at the church. Coming to do that on that day. All right. Now we want to wrap up today. Y'all make sure y'all continue to go see the vendors. We're almost there. Amber, where's Amber? There she is. Amber's going to come from Tillix, and then Promise is going to come right after her. And right after that, we're going to wrap up the day. Again, thank you all so much for coming. I really appreciate you all. Listen, watch out for Man to Man, the Prostate Cancer Support Group of Dallas, Texas. All right? Watch out for it. It's coming. That's going to be our support group. I have a meeting next week with Zero, so we're going to put it all together. Man to Man, Prostate Cancer Support Group here in the Dallas area. All right? Come on, darling.
All right, I'll keep this short and sweet because I know Dr. Wright said folks have some graduations and everything. My name is Amber. I'm here with Telix. Telix is a biopharmaceuticals company that develops diagnostic and therapeutic agents for different kinds of cancers. One of those is prostate cancer. So we have a product called Illuccix, which is used for prostate cancer staging. So after somebody's been diagnosed with prostate cancer, they're generally sent for a bone scan, CT scan, or MRI to determine if or where the prostate cancer has spread. They could also be sent for something called a PSMA PET scan. And so Illuccix is the radioisotope that's delivered for that PET CT scan. So the way it works is you're injected with a very small amount of this radioisotope intravenously. It binds only to proteins that are expressed by prostate cancer cells. And then when you go through the PET CT scan, the images light up all over the body. Hopefully they don't, right? But if the cancer has spread, it will light up and you can see really clearly where the cancer has spread. And so this is important because the data is showing that this is more accurate than the conventional imaging like MRIs or CT scans. And the reason that's important is because it can give your physician more information so that they can be more confident and better determine your treatment path forward. So what we hear often from patients and physicians is that they'll have a treatment plan in mind, but then after the PSMA PET scan, they'll decide to do something different. And of course, if you're going through any kind of cancer treatment, you want to make sure that what you're doing is going to be right for you. So that's what we do. If you have any questions, you can stop by and see us and ask me, or look online at illucix.com. I just want to say thank you. I don't know where he went, to Dr. Wright for having us. It's a really awesome thing that you've put together here. It's really awesome what you're doing for the community, and Telix is excited to be able to support you in the future and hopefully be here next year.
All right, y'all. So look, Mr. Hampton had to leave, so we want Natalie to come and talk about promise. We, for some reason, we can't get the PowerPoint to show. I'm crazy. It's crazy. So y'all just hang with us just for a little bit longer and let Natalie come and talk about promise. And then we're going to connect some kind of way to do a Zoom where you guys can, because y'all need to see this presentation. So if you don't mind, just clap your hands as Natalie comes to represent promise. Sisters from Zeta Phi Beta, please don't leave. I want to take a picture with y'all, okay? Thank you.
All right. Thank you, Dr. Wright. I'll make this quick. I know everybody's ready to head out. Really quick, I am a part of PROMISE. So PROMISE is a genetic testing study that is completely virtual. So we're available throughout the entire US. And it's a genetic testing study that's provided for any prostate cancer patients that have been diagnosed, and it's at no cost to you if you are a prostate cancer patient. What's really unique about PROMISE is that it is virtual, right? So you don't have to necessarily go through your doctor, through any of your providers to sign up. Of course, we encourage you all to definitely talk to them when it comes to signing up for studies, but if you just want to sign up today, you are free to do that as well. So by my booth over there, I have a brochure that will tell you kind of the steps that go into signing up. So you just register online. And when you register online, you will basically sign up and create an account, right? Like your email address and your shipping address, I should say, excuse me. Once that's done, then we will send a saliva sample kit to your house. It's very small. So you do a basic saliva sample. And once you do that, you will ship that back to the lab, which is color, and they will do the results in 4 to 6 weeks. And again, it's at no cost. So the shipping label is provided, it's free, and you can just sign up today. It's very, very, very simple. And trying to think what else would be important for you all to know, but overall, it's a very simple test. Great way to learn about your hereditary makeup, to learn about, you know, if you have a carrier of a genetic mutation, I should say, and pretty easy. But if you have any questions, I'll take questions now, or if you want to pass by, I can answer some questions as well. Thank you.
Okay, we are there. We made it. We made it through all the technical difficulties and stuff that we had. We still made it. But look, y'all, thank y'all so much for coming and for staying. This is not an easy thing to hang out at because so much information. But if you're here, you're still here, go back and chat with these vendors. They have some valuable information that they can share with you all. And to all of our award winners, scholarship winners, we're so proud of you all. And don't take this thing for granted. This is a lifestyle change in the breast cancer and prostate cancer world. Those of you all who can pray for our organization, that the Lord will open up this window and this door to get our footprint into Africa, and to continue to do what we do in the Dallas-Fort Worth community. So thank you all so much. Go back in there, talk to the vendors. We have a few cookies left if y'all want a couple of cookies and some sodas. Don't forget, if you want to make a donation, all you gotta do is scan the QR code. We are so grateful to all of our sponsors that came out today, and our vendors too. To all of my brothers at Phi Beta Sigma Fraternity Incorporated, thank y'all. Appreciate y'all coming, man. That meant a lot to me. It meant a lot to me. I love y'all too. All right, that's it. We're done. Hey, my nieces, I saw y'all creep in there. All right. We'll see y'all next year.